Okay, welcome this afternoon to the Committee on Children public hearing. Um, and I would just like to get started so that we can move through this quickly. Our first up is the interim commissioner on the Department of Children and Families.
Who may not be here. She's
She
still
is.
testifying in, oh, my goodness, I apologize.
Welcome, Commissioner Hamilton.
Good afternoon. I'm about to say good morning. Good afternoon. Good to see you all. Senator Marr, Representative Paris, Senator Perillo, Representative Dauphiné, and distinguished members of the Committee on Children. My name is Susan Hamilton, and I am currently the interim commissioner here at DCF. And I am submitting testimony today in support of Senate Bill 155, an act concerning the recommendations of the Department of Children and Families. This bill was submitted by the department, and we thank the committee for raising it and respectfully request a favorable action on the bill. There are several sections of the bill, so I'll just walk through those real quickly and then open it up for any questions you may have. The first section is really a new section that creates an annual report, and really what that section does is takes 8 existing statutory reports that are spread out through other sections of the statutes and combines them into one annual report that will be filed. I have identified transparency and accountability as a priority under my leadership at DCF, and I think this will help to not only streamline the reports, but will also help to make them more efficient and add more opportunities to the extent there's a need to add any additional reporting requirements moving forward. Similarly, Section 2 also seeks to combine an existing reporting requirement related to the Behavioral Health Partnership into an also pre-existing section dealing with reporting for that same partnership. We have been filing those reports in collaboration with DSS and with DMS for the last several years. So there will be no substantive change there. And I should also highlight the other reports. There's no substantive change. So it looks in the bill as if it's a lot of new language. It's really creating just one spot where all those pre-existing reports will be found. And then Section 3 also clarifies the reporting requirements for the department when there is a child who is missing from care or AWOL from the department's care and custody. The existing statute in 17A 8B has a requirement that DCF submit notifications through the FBI National Crime Information Center. DCF does not have authority to enter data into that system. Only law enforcement can enter data into that system. That recommendation for a statutory change was made by the auditors almost a year ago, April, in their report. So that will just streamline and eliminate a requirement that we're not capable of actually complying with. But the existing notification requirements for notifying through the National Center for Missing and Exploited Children will remain in the statute, as well as the notification to law enforcement. Law enforcement then will enter the information into the FBI database. And the testimony does also highlight some recent policies and practice guides that the department has issued related to our work around children missing from care. And so that's also highlighted in the testimony. And if there are any questions about that, I'm happy to answer those. And then the remaining sections of the bill 4 through 9 are just basically the sections that are eliminating the reporting language that's been put in Section 1. I thank you for the opportunity to testify. I'd be happy to answer any questions.
Thank you. I just have a question to start, and then we'll move through. My question is around Section 3 and the reporting that needs to take place, that where it's from someone from the outside looking in. It sounds terrible that we're taking out a reporting to the FBI on missing children. And yet my understanding, and I'm asking this for clarification, is that you at DCF do not have access to the database that you've been asked to report to.
That's correct.
And that So how are we making certain? I, I think you said it just now in your testimony, but I want further
Yes.
clarification so people understand that we are actually still very much focused on missing or exploited children, and how are we making certain that the FBI knows about them? How are we making certain that we're tracking them? Can you speak a little bit more about that?
Yes, I appreciate the question, Senator. You're absolutely correct. The existing statute that requires us, and we still will continue and do, notify the National Center for Missing and Exploited Children and law enforcement. Law enforcement then makes the notification to the FBI database. That's how it has been happening in practice. And when the auditors did a review, they indicated that statute was precluding us, the department, DCF, from notifying using that database. So really, it's just, it's not eliminating the notification, it's eliminating that DCF does the notice itself because we do not have access to that FBI database.
And so how are you making sure that that information gets into the database?
So through our coordination with law enforcement, when we're doing the notification to, and there's a lot of acronyms in there, but the NCMEC database and to law enforcement, and through our ongoing partnership with law enforcement when we are dealing and working together on a child who is missing from care. So
Okay.
that's how that will be accomplished. So there's, and I do want to just also reinforce the department's commitment. This is, you know, and I was a little concerned this might get it might be misperceived, as you were indicating, as being a reduction in our attention to this issue, and it's absolutely the reverse. And I want to make sure that that's very clear, that we are committed to that, and this will just clarify, again, a provision that was not, we were not capable of complying with due to the database access issue.
Thank you very much.
You're
Other
welcome.
questions? Representative Dauphiné?
Hi, thank you for being here today. My question is, we were talking about missing children, and in that context of that, can you, and this isn't really part of what you were talking about, but can you just tell us how many are missing in this state right now that you have no idea where they are? I know that I've looked at a lot of data, so I just wondered if you could identify, you have no idea, they have completely gone off the grid.
I may access that information from my team, but I can tell you this: the numbers of children that we have so missing from care is a large umbrella as far as how it's defined.
Right, I
So,
know
right,
that.
Yeah, so it includes kids where we would not have any idea where they are, but the bulk of the children are kids where we are maintaining ongoing contact. Those are kids that would be called AWOL. They're not at their foster home or at their placement, but we know where they are. They're texting with the worker. That's one category. And so they're all combined under one umbrella. But a very small number of children. We have about 3,200 children in care, and there's usually, of kids that we don't know where they're at, less than probably 100, 150 at any given time. And that may be a high number. I'll clarify for you all exactly how many of those are actually AWOL, where we know where they are. They're with friends or they're staying, but they're just not in their placement where they're supposed to be.
Thank you for saying that, because can you just explain a little bit more on those categories? Because I think it's really important to understand when a child is considered missing
Yes.
versus has disappeared off the grid.
Yeah.
Just if you could.
I could, thank you. Yeah, I think the missing from care phrase is a federal phrase that has a definition that's different than how we might define it. So when missing from care would, I think, understandably give the impression that no one knows where they are. They're missing for long periods of time, whereas the AWOL, another acronym, but authorized without leave, meaning that they are just not at their placement. Say they were supposed to be home at 5 and they're not, you know.
Correct.
And that's the majority of the kids, that if they are not where they're supposed to be, we know where they are, and they're texting with the worker and staying in touch. The broader category of missing from care, where we don't know where they are, is a much smaller number. And I did also want to, I guess, sort of highlight too, we are making considerable effort to make sure not only that we're doing the work up front to try to prevent kids from running away from their placements, from running away from their, you know, whether it's a congregate care or a foster home, and in addition, when they are returning from care, doing an assessment when they are returning from care to really identify what prompted it, what contributed to it, what are some of the services and supports that that child may need in order to prevent that moving forward. But of the children who are either missing from care or AWOL, the majority, 70%, if not more, are returned in one day. so they're missing for a day or less.
Thank you. I appreciate that data. That was what I was looking for.
Right.
Representative Pizzuto, followed by Representative Wielander.
Thank you, Madam Chair. Commissioner, just quickly, it says they must notify under Section 3 the state and local enforcement. Does that mean the state police? Because I don't see them in, once you know.
Yeah, generally, it is the location at which they went missing. I'll use it like that. But we will often, particularly if the state police covers the catchment area, we would do law enforcement, as much communication as we can, both state police and local. So we try to do both depending on the nature of the missing from care episode, and where that may have occurred at.
And do you know if they do one of those alerts on the billboards throughout the state while the FBI is processing this?
Yes, yes.
Okay, very good. Thank you very much.
You're
Thank
welcome.
you.
Representative Wielander.
Thank you, Madam Chair. Good afternoon. I almost said good evening. I was getting ahead of
Feels
myself.
feels like that.
I appreciated the testimony regarding this bill, and I just had a couple of questions. Will there need to be a memo of understanding between the agency and local law enforcement regarding the reporting to the NCIC?
I don't believe so. We'll certainly look at whether or not there's a need to provide more specificity and how, because that is how we've been operating. And it was just an antiquated legislative language that kind of, I think, was just not removed at the time the statute was passed. But I think it's been working pretty seamlessly, but certainly I think it's a good suggestion to look to see whether or not there's a need to review and make sure that there aren't any situations that are falling through the cracks there. But I think we'll certainly take a look at that.
I would appreciate that.
Of course.
Thank you. And has there been any hang-ups with regarding reporting to the NCMEC or NCMEC?
No.
Yeah, okay.
Yeah.
Great. The other question I had was regarding the consolidation of some of the reporting process. And I appreciate efficiency. I think it's great if we can reduce the number of reports that are coming in so we can look at a bigger picture more clearly for information and data. Are these reports going to be made available online, and will they be going onto CT Kind? Where would they be?
I think that's a great question. One of the things that we are trying to do is, well, a couple of things related to the transparency and sort of a public-facing goal of having a public-facing dashboard of sorts, I'll call it that, and then also looking at many of the reports that we have been producing have been made available online, but we did recently restructure the website, so I think it's a really excellent question to make sure that if they're not already there, that they are there, but then also that they're in a place that is easily accessible. And I do think having one streamlined report that we could put right on the homepage that has all of the information in one place will be really helpful. Because I do think historically those reports have been, while maybe available, fragmented a little bit in various places depending on the practice area that the report pertains to.
Thank
So,
you.
yes.
Yeah, for clarifying that. I think it's really important to make sure that that information is available. And I know that there's always a little bit of a transition and growing pains when it comes to switching over to a system. But I know there seems to be some hiccups with CT Kind and making sure that all of the reports are available from the transition point forward. So if we can alleviate those and make sure that moving forward we can have access to all of these reports, we can have that not only the legislature but also the public. That would be greatly
Absolutely.
appreciated. Thank you
Absolutely.
very much. Thank you, Madam Chair.
Thank you.
Representative Paris, followed by Representative Lanu.
Thank you, Madam Chair. Madam Commissioner, just a quick question. If the audit's recommendations were for us to streamline this report and to forego it, were those recommendations in terms of the reporting to NCIC, was that made to other states? And how many other states have foregone that process?
Well, I think since no state can, and only law enforcement can enter it across states, I don't know if they made similar, I don't know other state statutory provisions, if they had a requirement that the executive branch agency submit that data themselves. If so, I'm sure other state auditing entities would also identify the need for statutory reform in that regard. But it was definitely a specific recommendation here just to eliminate that reference. So my guess would be if other state statutes have similar provisions, they were probably also needing to amend those.
All right, thank you, ma'am.
Representative Lanu.
Thank you, Madam Chair. Hello, Madam Commissioner. How are you?
Good afternoon, sir. Nice to
Very,
see you.
very nice. Likewise, very nice to see you. Yeah, just to follow up, I was also at the public information hearing where the auditors presented their report. I believe you were there as well that day, and I would be honest. I was concerned, deeply concerned, particularly with the number of consecutive days that children were missing. Right, so some were missing for, I think it was like, there was like, again, I'm doing this off of memory. I don't have my notes in front of me from the meeting. So I want to have that caveat. I believe it was something like 18 kids were missing for several months. I think it was around 3 months. Now, I'll clarify, and I'll grant you either AWOL or missing from care, right? And then I believe there was about a dozen or so that were under the age of 12, right? And I also understand that, during the testimony, that if a kid comes back an hour late from the ball field, that's considered missing for a day. And that's where there's such a large number. Where I was concerned during that testimony was a lack of explanation where these kids are, right? And I know part of the testimony was there was such a large quantity of and some of them were repeat offenders, if you call it that, or absentees, where they're missing for that day, but in reality, it's coming back an hour late from the ball field, right? So it's impossible to, out of those hundreds and hundreds, to qualify or trying to explain where every single one went.
Yeah.
That, I understand that. I understand there's limited personnel, there's limited hours in the day, limited manpower. But where I struggle is over a 2-year period where you have a cohort of 18 kids that are missing for more than 3 consecutive months, or AWOL for 3 consecutive months, a dozen that are under the age of 12. So we're talking very, very young children. And there was no easy report and easy access for the auditors to be able to look at that and examine that and say, where were these kids? I think at least for those 2 groups, there should be some type of investigation, some type of documentation, something that the auditors, when they're reporting back to us, can easily try to qualify where the hell are these kids for that amount of time. And I really think that needs to be very investigated. I think we need to have a clear understanding of that as legislators, and certainly I think the department needs to have that.
Yeah.
And I know you started answering it, but what specifically, when can we expect some sort of reports, follow-ups on those type of cases?
Well, thank you for the question. First of all, we share, obviously, any concern around any child who's missing from care for any period of time, right? That audit, which was covering so I'm going to share some positive news to start with, is that audit period that I think went through the fiscal years ending 21, 22, 23, and then the report was issued 2 years later, about a year ago now. On the heels of that, or while that review was underway, the department was working with our federal partners and others on enhancing the department's response to, and the coordination of, both in a preventative way and on the heels of a child's return from a missing from care episode. And we recently just issued new policy and practice guidance on that. So I do think that the improvement and enhancements to the work that we do in that regard will be demonstrable. The other thing, though, I would say, as far as like ongoing reporting, certainly, and we're happy to have conversations around what, how those numbers are looking and what's happening with that. We do see a downward trend in the number of kids that are, and again, I'll use missing from care as the umbrella term. But what the audit, as you may recall, highlighted was, and again, I want to caveat everything I say by saying we don't want any children missing from care or running away from their foster homes or programs, is that there were a small number of kids that accounted for the majority of the episodes, right? So that, including the episodes where they were missing for longer periods of time. But those tended to be outliers. And again, not to minimize the concern of the outliers, but that's also what the audit highlighted, because of some of the factors and the variables that impact these kids that are in DCF care and custody oftentimes. You know, they're coming from a trauma background. There's lots of, other issues and concerns. And I will say that along with the changes and updates and revisions to our policy and practice, there's also other variables that we have, and myself in my new role, setting as priorities that will also help in a preventative way from kids running away from their placements, right? One of them we know, when kids are with people that they know, either in relative care or in foster families, but particularly in relative care or fictive kin with people they know, they're less likely to run away. Similarly, when they're placed with their siblings. So there's lots of and I think the audit in part highlighted that, but we also, subsequent to the audit, did a review of our own prospectively to sort of see, let's look at some of the recommendations that came, embed that into our practice and policy, and then also move forward with ongoing review.
Okay.
Ongoing review.
Yeah, so here's, I guess, my question. Those two particular groups that I mentioned, that group of 18 and that group of 12, and this is where I didn't really get a clear answer when we had that hearing with the joint committees in the fall. Did DCF in those particular situations, did they do an investigation, a full and proper investigation, determining where these kids were, who they were with, the circumstances around it? Again, we're talking like either over a 3-month consecutive period, or under the age of 12 years old. In those two particular cohorts of kids, was there a full and proper investigation with what happened to those kids?
Well, I'm going. Let me caveat again my response by saying when a child is returned from a missing from care episode, we would have to. When I say investigation, I just want to make sure we're sort of talking about the same thing. A review of what were all the circumstances, exactly what you're saying, that gave rise to that incident. What in reviewing that, were there issues with regards to whether it be a practice concern, a policy concern, a performance concern, or are there other variables that impacted that episode? In addition, the investigation, as I would call it, would also include the requirement that there be an assessment of what that child is going to need moving forward. So I want to say I'd have to look at all the cases that we're talking about, because I wasn't in the seat at that time, but certainly that's part of what we would expect, so that we can learn from that and make sure that those individual children's needs are being met. So certainly I think we can have another conversation around those specific cases that you're referencing, because I also think that I want to make sure we're talking about the same number of young people.
Yeah, and I mean, understood. But when the examiners were here, the auditors, and I'm like, what the hell happened to these kids? And they said, we have no idea. We didn't have access to the reports. There was really no explanation, and we don't know.
Yeah.
Where they should be able to put their fingers right on it, to be able to quantify it and give us a clear understanding. So,
Sure.
not being able to do that really gives me concern. And I understand what you're saying. There's the textbook definitions of AWOL and missing from care, where essentially, I don't want to put words in your mouth, but if I'm understanding you correctly, AWOL is, okay, they're not currently in the they're not currently within the DCF home or placement, but we know where they are, even though they're not supposed to be there. We know where they are. Compared to missing from care, it's a big question mark, right? Where I'm trying to delineate this is within AWOL, for example. How do you determine that you know where they are? If they're out of state and they say they're with Uncle Ralph in Boston, how do you know that's really Uncle Ralph they're with in Boston and it's not Mr. Interstate sex trafficker.
Sure. Well, more often than not, the workers they know that, particularly if the worker has been having an ongoing relationship with that child as far as being their caseworker for a period of time. They generally know the places where those kids are going. They know their friends that they're hanging out with. They're usually texting each other. The child is texting, the youth is texting the worker to let them know where they are at. So I do want to clarify that when we're saying, no, I want to make sure that there's not a misperception that what we're saying, that we don't, when we are working with an individual child who may be missing from care or AWOL, that as part of that we don't have a way of documenting. So not only what we're doing to try to locate the child if they're truly in a missing from care where we don't know where they are, right? But then also what we're doing when they return. So that is documented in our case files, in our case records. So I don't know what the prior, during the other public hearing last spring, or no, late, actually I think it was towards the end of 2025, August 2025. I don't know exactly what questions were asked there of the previous commissioner, and what answers that the group felt were not answered properly, but certainly I'm committed to following up on those to the extent we need to clarify anything that might have been asked and answered at that hearing. But I do want to make sure that when we say there's no record, there is a record. There's documentation in the individual case records regarding the work that's being done to either locate and or to support when the child returns.
Okay, I appreciate that answer. I guess I'll ask you, like, within what period of time do you start generating reports? Are they missing for 5 days, 10 days?
They're immediately, yeah. So we would know immediately as far as an incident where the child is either AWOL or missing from care.
No, I understand, but
Yeah.
like, what's the trigger for the amount of time that they're missing? So if a kid came back an hour late from the ball field,
Yeah.
like they said, that's the department does not have the capacity or the manpower to be able to generate a report every time that happens necessarily,
I
compared
see.
to, let's say, somebody that's missing for a kid that's missing for 6 months. So at what point do you start
Yeah.
generating that report? Like, what period of time
Well-
that the kid would be missing for?
So report meaning report to law enforcement and of that nature?
Well, even after the kid comes back. So if the kid was missing for 30 days, and you're writing that report that you say, explaining where they were, what information you found out, the follow-up interviews that you do with the kid.
Yeah.
What period of time that they were missing for, does the department make sure they do that interview with the child?
Well, that has to be documented within 5 days, documented in the case record, any activity regarding that assessment, that return assessment within 5 days. And any activity on a case has to be documented in the case record, should be documented in the case record within 5 days.
Okay.
So if that's what you're asking, that's the time window. Notification to law enforcement within 24 hours is different triggers depending on the nature of the episode.
Right. Yeah, and I guess I'm thinking like the Monday morning quarterbacking. Once the child is returned into DCF care, that follow-up investigation trying to determine where that kid was, where they went for that period of time. For what period of time when they're out of care, when they've taken off in one way or another, what consecutive period of time do you guys have a policy where you're going to do that Monday morning follow-up report? With essentially interviewing the kid, doing that sort of investigation, trying to determine what happened to the kid.
I think it's immediate, honestly. I mean,
Okay.
I think it's any period, because even if it's an AWOL, and like I said, the majority of the kids are back within a day, you still want to be documenting what led to it, but then also upon return, does this child need something different than he or she was getting prior to running away?
Okay.
Does that answer your question?
Yeah, partially.
Okay.
Yeah, I do appreciate you what you're trying to do. Look, I think the bottom line is we have to definitely have a streamlined process where we can have something where when we have the auditors go in, when they're looking at this, they can be able to, especially these cases for missing or being out of the care of DCF for several months. So a number of these kids under the age of 12, I want to know, they should be able to read the report and understand very, very quickly what happened.
Agreed.
And they were not able to do that, and that's a concern.
Yeah.
So I just want that noted, but thank you, Madam Commissioner. I've got nothing further.
Thank you.
Thank you, Representative. Anyone else? Seeing none, thank you,
Thank you,
Commissioner.
thanks so much.
Next, Christina Gio, the Interim Director of the Office of the Child Advocate. Good
Yeah.
afternoon.
Good afternoon. Good afternoon, Senator Marr, Representative Paris, Representative Dauphiné, and Senator Perillo. I'm not sure if he's online, and members of the committee. My name is Christina Gio. I am the acting child advocate at the Office of the Child Advocate. I'm here today to testify on two bills, Raise Bill 157, an act concerning municipal camp safety, and Raise Bill 156, an act establishing a task force to study the voluntary surrender of infants. I'll start with Raise Bill 157. So the Office of the Child Advocate supports the committee's efforts to improve safety for children in municipal camps. As the members of this committee know, municipally operated youth camps are currently exempt from licensure from the Office of Early Childhood. And that issue most recently came to light after the arrest of a municipal camp employee on allegations that he sexually abused children. There were a number of concerns with regard to that incident, and there was a fairly detailed examination of sort of the facts of what happened by Pullman and Comley. Our office, after that report was completed, identified a couple of issues that we felt needed some further investigation and response. Earlier today, we did issue a report with regard to one piece of that investigation, which is this issue of mandated reporting, background checking, and information sharing with regard to municipal camps and other license-exempt entities. We are looking at another issue with regard to that case, which is the length of time between the time that the incidents were reported and the arrest. So that piece is still part of an ongoing and active investigation with our office. We did not issue recommendations with regard to that piece today, but we did issue findings and recommendations with regard to what I would call the systems that are in place to protect children in child care settings and youth camps. And you know, what we looked at and what we reported on is the sort of gaps that occur when we have an unlicensed or a license exempt setting. We have a number of things that are in place that apply in schools and that apply in licensed child care settings and youth camps, specifically with regard to mandated reporting, background checking of employees, and notification, both that a report's been made and that an investigation's been completed. And so what we found is that, well, a few things. First, mandated, for people who work in license-exempt childcare settings, they are not included in the list of mandated reporters currently because the way that's described in statute specifically says licensed by the state. So the individuals working in child care settings that are license exempt are not mandated reporters. That is, for obvious reasons, a concern. We also found that there's currently no requirement that individuals employed in the license exempt child care or youth camp settings be trained in mandated reporting. So in licensed settings, youth camps and child care settings, OEC regulations require training, but because these entities are license exempt, there is no requirement that they have mandated reporter training. With regard to background checks, again, they're exempt. And with regard to information sharing, it's a little bit more complicated because the statute does require DCF to provide notice if an individual who is employed in a public or private institution or facility caring for children is reported or when the investigation is completed, that's required that they share that information. However, that term is not defined in statute, and for issues that are more complicated than we need to get into the statute, there's definitions of facilities, but they may not apply because there are exemptions for those who are not licensed. So we are concerned about that, and it does create problems. So a couple of things in terms of those findings. So when we talk about the license exempt entities, it is municipal youth camps, municipal child care settings. So there's a difference between an after-school program and a camp, like a summer camp. So it's the municipal camps, the municipal child care settings, those run by national boys and girls clubs, and frankly, a very long list of entities that are exempt from licensure. So what we recommended, and we would urge the committee to go a little further than what the bill does right now, to make some changes. One would be to clarify the list of mandated reporters to ensure that it is essentially all employees in a youth camp or child care setting, whether you are licensed or not. We would recommend that as well, all of those employees be required to complete mandated reporter training. With regard to background checks, we are recommending, again, that all of the license exempt youth camps and child care settings also be required to conduct background checks with a few exceptions. So that list of exempt entities includes like informal family arrangements. So our recommendation would exclude those informal family arrangements, those administered by religious organizations, and those administered by or through the federal government. And then lastly, we are recommending that there be some clarification of that term, public or private institution or facility, to ensure that when there is a report regarding someone who works in an otherwise license-exempt entity, that DCF shares that report, and that when the investigation is complete, they share the results of the investigation, including a copy of the report. So those are sort of our recommendations with regard to the municipal camps. From our perspective, and we testified a little bit about this last year, licensure would be the gold standard. It is the ideal thing because there are a host of safety-related pieces of licensure. That said, we recognize that licensure does come with some financial burden, and many of the programs that are exempt provide low-cost child care. But our perspective is that whether a family is accessing a licensed or a license-exempt child care setting, the very basic foundation should be that there are no employees there who pose a known safety risk to children. And that's really what the background checks and the information sharing is about, and that's what we believe needs to be addressed in order to sort of close that gap in the system. I did also submit testimony with regard to Raise Bill 156, the Task Force to Study Voluntary Surrender of Infants, that it is critically important that we have ways for people to voluntarily surrender infants that are safe for both mother and child. And we just made some recommendations to include, for the task force to include information gathering with regard to maternal and infant health and safety, so that if there are alternatives, that we're ensuring that whatever those alternatives are safe for mother and child. So that's my testimony. Thank you for your time, and I'm happy to answer any questions you may have.
Representative Pizzuto.
Thank you, Madam Chair. Commissioner, or I should say Advocate Gio, Did you submit the testimony?
I did, but I apologize. It was submitted by someone from my office as I was coming over a short time ago, so I apologize for that.
Okay.
It's been a,
I mean, it's important what you're saying. I just want to have a copy of it.
yeah, it is submitted, but it was submitted, like I said, as I was driving from my office to this building, so
Okay.
I apologize for that.
Very good. Thank you. Yep.
Thank you. I appreciate you asking that question because I was searching for it in advance as well. Representative Comey? I'm sorry.
Hi, Christina. Thank you so much. Thank you, Madam Chair. I was wondering, you discussed a little bit about the exclusions of the background checks, and you mentioned informal family arrangements, I believe is the term, and then programs run by the federal government and religious organizations. And I'm just wondering why those exclusions?
Right. Well, I think from our perspective, it's an attempt to strike the right balance. So the definition of childcare settings is really based on the number of children in one place. So it's 12, right? So childcare center, there's several different definitions, but childcare center offers or provides a program of supplementary care to more than 12 related or unrelated children outside of their home. And then there's sort of, family care homes are smaller and they can be in a home. So informal family arrangements, for our thinking, there might be families who, the kids are gathering at one relative's home, and we think that's probably not necessary to do background checks with regard to those informal family arrangements. Religious organizations, honestly, was because of the separation of church and state that we felt that should be, that it was appropriate for that to be exempt. And then the federal one is with respect to, let me just find it, because it's essentially military families that have these federal child care centers, and so we thought it was appropriate to exclude them and allow them to continue as they are.
Okay, thanks for the clarification. I appreciate that.
Thank you. Representative Wielander?
Thank you, Madam Chair. Good afternoon. I was wondering if you would be able to, this may not be the right question for you, but I know that in the past we've heard some concerns about how are we going to actually get these background checks done in a timely manner, especially for seasonal camps and programs that are hiring people, at the end of the high school year, and then camp starts next week, all of that to think. Can you speak to that challenge, and if you have any recommendations on how we could streamline that process?
Sure. Thank you for that question. So what we recommended, well, let me back up. There are different rules for background checks in the child care settings versus the youth camps, and I think the youth camps are the ones generally that present with that issue of it's going to get up and running quickly, and we've got to do the background check quickly, and they have separate rules. So they have a much, they have a broader array of ways they can do the background checks, right? So they can check on the judicial branch website, for example. And so what we're recommending is that essentially the changes would track. So if we're talking about a currently license exempt youth camp, like a municipal camp, that they would be able to use the same lookup that licensed municipal camp, licensed youth camps use, right? So that there's that streamlining, because it does take a long time to get the background checks. With regard to other child care settings, I think that it does make sense to require adherence to the fingerprint check and the sex abuse registry check and all of the above. One of the issues, I think, is that the state doesn't know how many entities there are for any one of these categories, whether it's municipal child care settings or boys and girls clubs or, daycare in a retail establishment, which is one of the exemptions currently. And so what we recommended in our report is to essentially provide some ramp-up time. Maybe set it out a year, have the first year just people registering, so OEC, the Office of Early Childhood, knows how many entities we're talking about, how many employees they would have, and can ensure that they have appropriate resources to complete the background checks. And that was sort of our effort to recognize that this would be a significant change, and we don't really truly know how many people we're talking about.
Thank you. Thank you, Madam Chair.
Representative Dauphiné.
Thank you, Madam Chair. Thank you for being here today. I have a couple of questions I just wanted clarity on. I know you make recommendations, and I'm assuming they're based on data. I wondered, you kept speaking about what you think and your perspective with regard to licensure and how it would be better one versus the other. Where are you getting your data that kind of substantiates that? If you could refer to that. I didn't see that in your testimony.
This report did not include a look at data. We do not have data on, for example, the number of employees in license-exempt entities. This was really a look at two things. We looked at what information was available with regard to what happened in Bethany, and we looked at the law with regard to licensure. We did not research data on whether children are safer when they're in settings where people are background checked to ensure that they don't have a substantiation or they're not on the child abuse registry. We thought that was a fairly reasonable extrapolation, that if people are in settings where there are background checks and we can ensure that no one working in those settings is on the child abuse registry, that will make children safer.
Thank you for that. So this was just what you think in your perspective, and based on one case that happened in the state. Just wanted to clarify that. But going to your, we were talking about the study on children with regard to, I'm trying to remember what bill number it is, with regard to surrendering children. And you had said, you repeated a couple times the welfare of the mother and the baby. I was wondering what you were comparing that to, because there's a lot of scenarios where children are literally left in dumpsters, left on the side of the road, that sort of thing. So what exactly are you comparing that to, your statement?
Yeah, there wasn't a comparison there. I'm just suggesting that if there's a task force to look at ways to voluntarily surrender infants, which I think is a good thing, right? We have safe haven laws for a reason. Maybe there's more that we could be doing. And so what we're saying is, and we testified a little bit about this last year when we looked back at our data in terms of child fatalities. We saw 3 instances since 2020 of young women giving birth at home and the infant dying. And so that's concerning for us. We don't want to see that for anybody. And so it wasn't really it's not an issue of a comparison. We weren't making a comparison. We're just saying that if the state's looking at alternatives, whatever those alternatives are, that we think it's important to look at those issues as well, right? We have a maternity mortality review board. We have an infant mortality review board. And just that information should be part of what folks are looking at as they think about what are the other safe alternatives and what could we be doing to do more to ensure that if people are in a situation where maybe they want to voluntarily surrender, that they can do that in a way that's safe for both the mother and the baby. That's really all we were suggesting.
Thank you. I appreciate that, because if I recall, you would testified against an opportunity to put a baby box at a hospital in the state of Connecticut. So I was just verifying that, because you're comparing the mother and the child, and I wanted to know if you were comparing it to a dumpster drop or a baby box drop. I mean, not all of them may not identify let's say the safety of the mother. If the baby were dropped off, the mother may have some postpartum depression and leave the baby there. The baby could survive and the mother may still have some issues. So I was just trying to get some clarity there because I think, as I understand it, that's what you're talking about, alternatives that would include both and maybe not one or the other. So I just wanted to clarify. Thank you. I appreciate your testimony today.
Representative McGee, sorry.
Thank you, Madam Chair. Thank you for your testimony. I have just a brief comment and a question. One of the things that I realized really quickly is that there is a lack of education and information surrounding safe haven laws. One of the reasons why I think we find babies in really vulnerable and oftentimes deadly situations is because there really isn't much education around safe haven laws. In comparison to, I was driving in areas of Connecticut this weekend and I saw the same billboard from an organization that wanted to make sure that young women in that community were well aware of services provided. And I thought to myself, if there was an opportunity for a young woman to learn about a safe haven law, then to take a very traumatic, experience, and that be obviously amplified because of the lack of resources provided to her, what would it be if it were marketed to her? So just from your perspective, what would be, because I know you said that we already have the safe haven laws, which we do, and there could be more work expounded upon that. What would a marketing idea in regards to safe haven laws look like in your perspective, or how do you think we could effectively make sure that young women are learning about it?
Yeah, I think that's a really good point and a good question. Certainly, I'm sort of thinking about the Safe Sleep campaign as a comparison, right? Ways of getting that message out that there are places where people can get help, I think is important, including the safe haven law. So just sort of thinking about that campaign, sort of like all campaigns, right? Get that message out wherever you can, where people who you want to receive the message will be, right? So whether that's radio or other things of that nature. I do think the state does some things. I could talk to the person in our office who's more familiar with the safe haven and what they've done in terms of market, for lack of a better term, marketing, but public awareness campaigns. And there may be more that can be done to raise public awareness. I agree with you. It's an important aspect of safe haven, right? Voluntary surrender. Safe voluntary surrender is only accessed if people are aware of it. Mm-hmm.
Thank you. Unless there are any other questions, I have one last question. It seems that based on what your statements were today about the fact that we do not have an overview of what municipal camps exist, how many exist, what towns they exist in, what kind of services they provide, who's employed within the municipal camps. Would it seem then that this bill requiring a work group to look at all of this would be appropriate to get us the information that we need in order to make next steps? And that's a real softball question.
Yeah, well, so thank you for the question. Yes, absolutely. I would encourage the committee to expand the purview of a work group to include not just the municipal youth camps, but the municipally run childcare settings, as well as those other licensed exempt entities, because there's sort of this incident that happens that draws attention, and we look at it and we try to learn from it, right? But when you zoom out and you look at the system, there are children in childcare settings all over the state that are not licensed and who are at risk because there may be employees there who are not background checked, right? And so I think a working group and sort of let's figure out what is the number that we're talking about is an excellent idea, and but I would encourage sort of just expanding that so that we can get at the other licensed exempt entities as well. Because I think the risk from this perspective of kids is the same.
So another bill, in other words. Thank you. Thank you so much for your testimony.
Thank you.
Next online, we'll have Lori Bruce. Thank you for joining us. Please go ahead.
Can you hear me all right?
Yes, thank you.
Okay. Good afternoon, committee chairs and members. Thank you for organizing this hearing. My name is Lori Bruce, and I'm a research scientist and bioethicist at Yale University. I'm here to discuss Race Bill number 156. This bill generally maps to Connecticut's safe haven law, and every state has a version of these laws. Much of my work is centered on informed consent, harm reduction, and evidence-based policymaking. And as a part of that, for over 10 years, I have written and lectured on safe haven laws. And every year I tend to help a number of states who are seeking to improve them. I've also served on a nationwide bipartisan safe haven task force and led the open letter 2 years ago to the U.S. Department of Health and Human Services, co-signed by 100 clinicians and child welfare experts, calling for federal oversight of infant abandonment boxes. Safe haven laws, as we know, are intended as safety nets for a relatively small number of cases. They're used by about 100 parents per year across the US, and here in Connecticut, the numbers are quite small. But since the Dobbs decision, nearly every state has been re-examining these laws, sometimes to extend the surrender window, sometimes to expand the options for where an infant may be surrendered, including 911 calls for in-person surrender to a paramedic or EMT that can solve a lot of the challenges related to timing and transportation and confidentiality. So safe haven laws generally face quite a bit of criticism for often failing to meet the needs of the community. There's a lot to get into there, but perhaps the cruelest part of these laws is how they fail to provide a safe labor and delivery option within either a hospital or birthing center, even though it's widely known that many of these births do take place outside of the hospital. So these are women giving birth alone, unattended. And this, of course, compromises the health of the infant and the mother and makes it hard for the parent to meet the safe haven requirement to surrender an infant who is unharmed. So a complementary policy response could be confidential birth, which I have studied and written about for quite a while. It is used by 11 countries in various forms. And in some places, it has helped nearly 40% of those moms to actually keep their children, because a careful implementation does mean in-hospital labor and delivery, or within a birthing center, providing crisis counseling, providing awareness of options, and a more meaningful informed consent process. So there's much to say here, but in closing, I think it's important to think about what problems we're trying to solve with which laws, and how we can hopefully look further upstream to reduce the likelihood that someone does need to use a safe haven law, and to really help hospitals understand how to respond to at-risk individuals. This certainly includes helping hospitals to know more about options like temporary placement, for example. Safe haven laws have notable complexities, and I'm happy to address any questions. And if you do move forward and assemble this committee, I'm happy to either serve as a resource to the community or potentially be a member if that would be helpful. Thank you.
Thank you. Representative McGee.
Thank you, Lori, for being here today, your insight, your expertise, much appreciated. So there's just a couple things that I heard that I thought was interesting and I think really important. My first question is, of the 100 babies that are surrendered through safe haven laws, is there data that shows the ethnicity of each child? I understand that most of these situations and cases are anonymous, but I'm curious to know if there's any insight on ethnic background of children surrendered per year.
That's a great question. Part of the problem with these laws is that there's no requirement by the state or federal government to store data related to these cases, and the numbers are quite small. However, I do know of at least one state, California, that has done a deeper, more organized analysis of their data. And I do know a number of folks who have been involved much more deeply in specific data points related to that. So I would be really happy to look into that. And if that's all right, I could get back to you with any information I could find to help address your question.
That would be great. My final comment is, you know, I understand that 100 is a small number, but in comparison to the 30 to 40 babies found in dumpsters and backpacks annually, I think that is yet a powerful number, especially as we are, you know, talking about the courageous surrendering of life. And while I think about the impact of laws on certain communities, just recently a young woman, maybe in Ohio, the case went viral because she freaked out and she placed the baby somewhere that the mailman or delivery man found and encouraged her to, you know, obviously raise. I shared this because oftentimes when these discussions come forward, it tells me the vast difference of who we represent and how these issues particularly affect and impact our communities. And so I think when we talk about safe haven laws and the establishment of them, we have to remember that specifically Black and brown women, right, where this was like an often thing where babies were found in just awful places, were never not only given the resources, but they were oftentimes unreported. And these are also, to me, a reflection of today where we talk about the lack of education in certain spaces when it comes to certain issues, right? And then others, everyone knows where to go, where to ask questions, where to get certain services. It's a concern when the number 100 becomes subjective. And so I just really wanted to raise that point. I hope that this task force can be something that we establish and really looks at the wide range of how certain experiences in certain communities impact people differently. So thank you.
I couldn't agree more. And part of what troubles me deeply is how when there are cases that are found of unsafe abandonments, which could be like the case you talked about where someone was probably trying to help that baby be found, but was scared and didn't know what else to do. When we do run across those kinds of cases, historically, we see really egregious rates of overly prosecuting women of color, and the cases with white women or white girls tend not to be prosecuted nearly as frequently, and that is another egregious problem. So I couldn't agree with you more. Thank you so much for your insights and questions.
Representative Paris.
Thank you, Madam Chair. And while I certainly appreciate the public comments on this particular issue, Lori, would you please be sure to share with us your information and send that directly to the clerk of this committee so that she might disperse that information to members of both sides of the aisle. I just wanted to put that on the record. Thank you.
Representative Mastro Francesco.
Thank you, Madam Chair. Hi, thank you for your testimony. Excuse me. Just I'm just a little confused on your testimony, if you wouldn't mind clarifying for me. Are you in favor of this policy or are you against it, and what your reasons are either way? I just wanted to get some clarification. I couldn't really figure it out based on your testimony.
Thank you so much. I am certainly in favor of laws that help to protect vulnerable infants. Safe haven laws absolutely must exist, and they have helped many families. However, they are written in a very uninformed way. They make all sorts of assumptions, for instance, about the moral fitness of women facing these challenges. They only focus on a very narrow window of time, which is after a baby has been born, as opposed to thinking about how can we provide a safe labor and delivery, both for the baby and the mom. The laws have many other problems with them. For instance, certain implementations violate the Indian Child Welfare Act. They also result in a rapid cessation of parental rights. And a lot of parents who choose this option may not know of other options like temporary placement, where other families can just help to provide care while the family, while the birth parents are able to seek some help to stabilize their any problems that they may have that are precluding them from being able to keep their children. So there's a lot of judgment kind of baked into these laws, such that if the birth parents ever want to get their children back, it's an uphill, if not impossible, fight. So there are laws that are considered Band-Aid laws, and there's many other ways that we could implement them in a way that would be much more trauma-informed, much more caring of both the infant and the birth mother and the family.
Thank you. Thank you for that answer. I just wanted to clarify it. I will say that this issue, to me, is not a matter of race. It's not. A baby is a baby. Whatever color, whatever their ethnicity they are, it's a baby, and it affects everyone. And sometimes with these issues, it kind of boils down to who it affects more based on race. So if it affected one race more than others, does that mean we don't protect the other people? It's about a person, not about race, just in my opinion. They're babies. But you mentioned something in your testimony that white women are not prosecuted as much as black and brown women are. Can you share with me the data and the facts where you got that from?
Sure. There was a book published maybe 4 years ago that went into a number of national cases. And I'm sorry, I can't remember the name of the book right now, but I can certainly look for that and share that with you, where it had summarized a number of cases. And there was a very clear distinction between white women who had either committed infanticide or unsafe abandonment of their infants. And when I'm able to find that information, I'll certainly pass it on to you.
Thank you. I appreciate it, because it's a very broad statement, and I'm just really curious about facts. Again, in my mind, this issue is not about race at all. It's about a baby, a human being, regardless of what their race is. So I appreciate your testimony. Thank you, Madam Chair.
Representative Comey?
Thank you so much, Madam Chair. Thank you for your expertise, Lori. It's good to see you. I just want to clarify when the previous representative asked if you supported this policy. The policy that we're looking at today is a task force. So when you submitted your testimony, yes, all of the pieces so far have been in support of a task force, because I think it's important that we recognize that we can come to a common understanding. And as you said, you've been revisiting the laws across the country, and the working with states to have those opportunities of expansion of some of these safe haven laws that are already in place. So I'm wondering what you have seen as far as some of the expansion on how to support the children, but also the moms, the parents who are giving birth, and to be, safe and well cared for, and have access to the information they need to make an informed decision.
Thank you so much for that question. I would say that for these laws, they often fail when there isn't enough public awareness. We could have the most perfect policy, but if no one knows about it, that's a big problem that was raised earlier in this hearing today. Also, in terms of actual solutions that a number of states are looking at or have implemented, relates to the window of surrender, relates to true informed consent, relates to better hospital policies so that when nurses are approached with these cases, they know what the different options are. Certainly, considering some form of confidential birth to enable these women to be able to give birth in a hospital or birthing center so that they aren't alone. Many of them are scared because they know that their name will be, they will be asked for their name when they enter the hospital. And it's not so much that they need absolute anonymity, but a lot of them just need an extra layer of protection so that, for instance, if they're a victim of domestic abuse and the father of the baby may be a relative, or there are all these complexities here where they can't really be found within the hospital if they're going there to give birth, and they may be really scared to have that explanation of benefits mailed to their home after the labor and delivery. And so to really help in these really tough cases, there's this idea of confidential birth. And that is quite similar, actually, to what hospitals already have in place. Many hospitals have a policy in place for famous people when they say, I can't go to the hospital because I'm scared that everybody's going to, want to visit me or so forth. And so there are already good policies in place that could be expanded and creatively used for this policy. And I know of a number of hospitals that are really interested in that. Some other states also have expanded the means of surrender so that parents can call 911 and an EMT will meet the parent at a location and timing that is safe for that parent, and to be able to learn more about the surrender and do the surrender that way. So it really depends a lot on the state resources, on a number of other factors. But those are some of the things that states have been looking at over the past couple of years.
Thank you. I just have one follow-up question. Are you concerned? I'm glad you brought up the confidential birth. I did put forward that bill last year and appreciated your support on that. I was wondering if you had seen is there any sort of, maybe you're studying it, maybe you're not, but any research that you've been keeping track of regarding our current situation with the federal sort of buckle down on undocumented women and men and kids, and if that has impacted any of the health and the safety of our children.
Thank you. Yes, in a number of current jurisdictions, in some places more extremely than others, patients are scared to go to the hospital. In some states, patients are required to disclose their citizenship. And those are the cases where I'm seeing the greatest rise in unsafe abandonments. Often those families are weighing, should I have an in-hospital birth, or will that put my other children and my larger family at risk of, for instance, being deported and so forth. So yes, in many places, we are seeing that there are complexities at the federal level that are certainly leading folks to make different kinds of decisions about whether and when they do seek in-hospital care.
Thank you, Lori. Thank you.
Representative Duffany.
Thank you, Madam Chair, and thank you for being here today. So you spoke a lot about what I would probably consider ideal situations, right? We always want to think about the safety of the mother and the baby. Ideally, they would have them in a care setting where they would be in the hands of somebody who knew what they were doing during the birth and given care afterwards. I know previously our representative talked about education, which I think are all important, very important. My question to you is, so I'm getting a little bit of mixed messaging here with you with the safe haven law. I'm not sure if you're suggesting that if it doesn't meet the ideal criteria that you describe, that it shouldn't exist. So would you agree or disagree that an opportunity to save the child, whether it be walking into a hospital and surrendering your child, or putting it in a baby box, or leaving it at a fire department where you believed it would be picked up and cared for, are you of the belief that those opportunities shouldn't exist because they're not ideal?
Thank you for those questions. I would start by saying that no laws are perfect, and as we implement laws and as we update them, they're always incremental, and the conditions are constantly changing on the ground, and all legislation, of course, is trying to keep up with how to be most responsive to many other external factors, which certainly may not have been predicted when various laws were put in place. So I'm not against safe haven. I am certainly in favor of safe haven, but like many other laws, there are many ways that we can improve them to help improve the lives of children and families and the birthing parents as well. With respect to boxes, what we see with boxes is that there are perceptions that they may be a better option. But I would say in considering whether or not a box may be appropriate, I think we want to examine, what these boxes really are, and how have other jurisdictions found them to be. So we do know that these boxes are not regulated, even though they have timers, they have electricity, they have HVAC, they need to control the temperature, and even our hair dryers, even tongue depressors, all sorts of much more basic tools require regulation. And so many people are within pediatrics, within child welfare, are exceedingly concerned that these boxes have no federal oversight from a regulatory perspective. I have also visited boxes that have been installed, and they do not meet the conditions that are often touted. For instance, I visited a box where there were cameras all around the fire station that were, so it was actually impossible to walk up to the baby box and have any sort of hope for any sort of anonymous surrender. The day I visited a box, I rang the bell and I knocked on the door, and it took me over half an hour to find someone because no firefighters or EMTs were present at that location. And then the people I found were actually electricians who were working on the firehouse. And I said, well, did you make sure that you didn't cut off electricity to the baby box? And they did not know what I was talking about. And I asked when a firefighter might be returning, and they said that there were many calls right then, and so they were unsure. So I think with any sort of policy implementation, the devil is often in the details. I do think we could look to Germany, who also installed over 100 boxes across their country, not in response to any sort of rising numbers of infanticides or unsafe abandonments, but because there was a certain organization that wanted to provide another policy solution just in case. And they did find that before, and when you compare the numbers of unsafe abandonments and infanticides before and after the implementation of 100 boxes, there was actually no change at all to those numbers. So it was considered an ineffective policy solution. But even more so, what was really interesting was that some boxes were used. And so that does imply, with the small numbers that were used, that those, the conclusion would be that those people would have otherwise used an in-person form of surrender. And so in that way, a box may indeed be taking away the on-site, in-person crisis counseling, the ability for a parent to learn about other options, the ability for a parent to be asked if they're okay. So these are complicated policy questions, and those are, Germany is not the US, and it's not an identical situation, but we're also aware of a box in Italy last December that had a problem with its sensor, and a healthy baby was placed into that box, and the baby died a couple of days later because nobody checked the box because the alarm did not go off.
Thank you. I appreciate your answer. You don't have to answer to this. This is just a statement, and I would tell you that 13 states, and maybe more now across the country, already are in our country, in the U.S., have baby boxes, which have been proven to be very, very successful. And I think what you're saying is, unless they meet your rigor of your safe haven policy, that they probably should be non-existent. And I would say that the baby boxes are probably always a better opportunity for life for the baby than a dumpster would be. So thank you for your comments today.
Next, I have a question, and then Representative McGeever the second time. So, did we lose Lori?
Oh, I'm here.
Oh, good. Okay. Just wanted to check. So what I'm hearing in your conversation around, or your statements around the safe haven law, and one of the reasons we're looking at putting this task force in place is that in the more than, say, 25 years since the safe haven surrender law has been put in place and put in hospitals with surrounding social workers to accept a baby, and also create a place where the parents could receive services in order to maintain and hold on to and grow their child. What I'm hearing is that we have a different understanding now, a different lens that we look at the world perhaps through, in terms of equity, race, and the issues around surrender, and the issues around community, and the needs of the people who might feel they need to surrender their child. So I'm thinking that from everything that you've said, that there is support to looking at this task force and looking at how we do this work. So thank you for your comments. Representative McGee.
Thank you, Madam Chair. I just want to share briefly on the transitional date of the greatest civil rights icon, Reverend Jesse Jackson. One of his most prolific advocacy areas was for the sustainability and protection of life. He established a national organization that helped to aid and support women in unplanned pregnancy situations. One of his greatest quotes is, "America is not like a blanket, one piece of unbroken cloth, the same color, the same texture, the same size. America is more like a quilt, many patches, many pieces, many colors, many sizes, all woven and held together by a common thread." And I wanted to share this because a woman's nuanced life and why she surrenders her child is oftentimes attributed to systemic barriers. And those are likely the reasons why she will surrender her child. For example, there are different resources in Greenwich than in New Haven. There are different billboards up in Greenwich than in New Haven. And race and heritage is also highly important in this conversation because it's important for a child to know who they are. It's important to know their identity. It helps them to ground themselves and root themselves in an ethnic and cultural experience that's okay to be celebrated. While America is unity and should be, we are not always often uniformity. That means that we can unite and not always look the same. So, Lori, thank you for your testimony, and I am highly looking forward to those statistics.
Seeing no more questions, Lori, thank you for your time.
Thank you.
Next, we have, and I'm so sorry, Josh, I'm going to absolutely blow this, but I'll try. It's Wojatina?
Pretty close. The J is silent. Wotina.
Wotina.
Yeah.
Okay, thank you. And coming from the Hole in the Wall gang.
Yes. Thank you, Senator Marr and the members of the committee for giving me this time to speak today. Yes, my name is Josh Wotina. I am a member of the Hole in the Wall gang camp, and I'm also representing the Connecticut Camping Association in strong support of SB 157. At its core, this bill is something simple, making sure every child in our state has the same basic safety protections no matter what kind of camp they attend. Right now, licensed youth camps require staff over 21 to be mandated reporters. Municipal camps don't. From a child's perspective, there isn't a difference. A camp is a camp. Parents drop off their children trusting the adults in charge know how to recognize abuse, how to respond to concerns, and how to take appropriate action. Requiring municipal camp staff over 21 to be mandated reporters is not an extreme step. It is a minimum safeguard. It ensures that the adults leading these programs are trained and legally obligated to act if a child is at risk. That consistency matters. It closes a gap that currently leaves some children with fewer protections simply because of who operates the camp. I also want to speak briefly about background checks. Requiring staff over 18 at municipal camps to undergo background checks should be considered a basic guardrail. This is already standard practice in licensed youth camps. It is one of the most foundational steps we can take to create safe environments for our children. Families assume this is happening. In many cases, they don't realize that it may not be. Finally, I support the task force and reporting requirement of this bill. Before we can strengthen policy, we need clear information. Understanding how many municipal camps operate in our state, how they are structured, and how many children they serve is an important step toward thoughtful, informed legislature in the future. Every summer, thousands of Connecticut children attend camp. They build friendships, confidence, and memories that last a lifetime. But none of that is possible without safety as the foundation. SB 157 is a meaningful first step toward ensuring that foundation is consistent across all camps in our state. I respectfully urge you to support this bill. Thank you for your time.
Thank you very much for your testimony. Any questions? Seeing none, you are good to go. Thank you.
Thank you.
Next is Emmeline Franklin from Connecticut Community Nonprofit.
Good afternoon.
Good afternoon. Please go ahead.
Senator Marr, Representative Paris, Senator Perillo, Representative Dauphiné, and members of the Committee on Children. My name is Emmy Franklin, and I'm a Public Policy and Advocacy Associate at the Connecticut Community Nonprofit Alliance. The Alliance is the statewide association of community nonprofits. Community nonprofits provide essential services to over 500,000 individuals and families in Connecticut every year, improving the quality of life in communities across the state. Thank you for the opportunity to testify on SB 154, an act requiring certain agencies to report costs associated with programs serving children and families, and SB 155, an act concerning the recommendations of the Department of Children and Families. Each bill emphasizes new data reporting requirements. The Alliance is concerned that these bills will place additional data collection and reporting requirements on the state's nonprofit providers for services to children, rather than analyzing and sharing the substantial amount of data that the state already collects from its community nonprofit providers. Nonprofits support transparency, accountability, and data-informed policymaking. Providers already partner with the state to collect extensive program and service data. State agencies and contractors gather large volumes of operational, outcome, and compliance data, and providers routinely submit reports across multiple systems, contracts, and funding streams. Nonprofits operate with limited administrative infrastructure. Staffing shortages already affect program delivery and compliance capacity, and each additional requirement requires staff time, training, data system adjustments, compliance monitoring, and quality assurance. This administrative burden comes with a cost. Contracts and reimbursement rates often do not cover new administrative requirements, meaning resources may be diverted from direct services. Ultimately, we appreciate the efforts to streamline reporting for DCF, and we should take this opportunity to examine what's already being collected and reported by contracting nonprofit providers. So please assure the state agencies that state agencies can report on the data they already collect from nonprofits without placing additional reporting requirements on nonprofit contractors. Thank you.
Thank you. Any questions? Yes, Representative Mastro Francesco. Well, they both
Thank you, Madam Chair.
at the same time.
Just for clarification, what reporting requirements, what is required right now for the nonprofits for reporting? What type of reporting do you do?
Yeah, that's a great question. There's significant reporting requirements. It kind of varies depending on the state agency that nonprofits are contracting with, but they're incredibly detailed. So DCF, for example, providers are required to submit an 8-month report that is basically an update of their budget and has incredibly specific data, including providers' names, number of hours they spend seeing clients, and really minute data.
Through you, Madam Chair. If you're saying that it's extensive enough, I'm assuming that what they're requiring in here, you're already doing, right? Are you already giving the total cost of administration of each program to the state? It doesn't seem unreasonable when I look at these requirements. Yeah. We all want transparency, and everybody wants to know where their tax dollars are going. So it doesn't seem unreasonable to me, just looking at it from a high level, that this is a real burden. It seems common sense to me. So I'm just trying to figure out exactly what you're reporting right now. What is different in this proposal than what they're actually reporting?
If I may, Representative, thank you for the question. My name, for the record, is Ben Shakin. I'm the Director of Public Policy and Advocacy at the Alliance. Thanks to the Chair, sir, indulgence for letting me join Emmy up here today. As you're hopefully likely familiar with from our conversations over the years in the Government Administration and Elections Committee, there's a lot of data collection that happens between the nonprofit contractors and the state, a lot of inefficiencies, frankly, in how the state works with data. For the Department of Children and Families specifically, providers do the extensive fiscal reporting that Emmy just outlined through the Office of Policy and Management's 8-month reporting. They report multiple times throughout the year on very, very minute details of their budget, including reconciling their budgets at the end of the fiscal year down to the individual staff person. They're also reporting a substantial amount of clinical and outcomes-based data to the department of children and families directly through what's called the Provider Information Exchange, or PIE. That is a manual entry data system where providers are interacting on a client by client, day by day basis, collecting information about their clinical outcomes. If they're serving someone who's a Medicaid member who receives their health insurance through DSS, through Husky, they're also reporting through the claims information to Medicaid on what's happening with their programs as related to healthcare. And so I think the concern that we have is not that that data doesn't exist or needs to be out there, but that it needs to be, as the department is looking to streamline and consolidate how they report it to you and to the public, that they do so without expanding the ask of providers to submit data to them, because we think all the data that's already coming in should be sufficient for them to be able to produce the kind of information that the legislature and the public is looking for. And our concern, frankly, is over the years, as new data asks have come from this body and other places, there hasn't really been a decrease on one side as there's an increase on another side, and all that it's sort of caused over the years is an increase in cost in administering the different data inputs, versus taking a sort of holistic look at what's being collected, whether you can get the information you need from what's already there, and figuring out how to deliver that information in a report to you or to the public.
Okay. Thank you for that. I don't have any further questions. Thank you.
Thank you. Representative Dauphiné.
Thank you, Madam Chair, and thank you for coming to testify today. I'm just a little confused because I think I agree that we want transparency, and the more information, the better. So I'm trying to. Does your agency take tax dollars as a nonprofit? I mean, are you appropriated money as a nonprofit from the state of Connecticut, or are you completely on your own, independent?
So
private?
the Alliance, as an association, we're a 501c3. We don't have an appropriation from the state budget directly to us. We're funded in a variety of different ways, which is all public on our 990 as any other 501c3. We do have a state contract. We manage the state's what's called the Preferred Purchasing Program, which is a program that connects people with disabilities to jobs in state office buildings. We don't provide those jobs, but we connect the providers that work with people with disabilities who are looking for employment with those contracts. In terms of the organizations that we're talking about today, what we're talking about is organizations that are part of a competitive contracting process with the Department of Children and Families, and other child-serving organizations or state agencies like the Court Support Services Division and the Judicial Branch, et cetera, not agencies that are getting earmarks, as you might commonly refer to them in the state budget.
Yeah, I think there's a little confusion here. So you're saying that tax dollars never, ever touch your organizations at all? I mean, through grants or through some kind of appropriations, or in some sense of the way, is that what you're saying? You completely run on contributions from the private sector?
No, not at all.
Okay.
We're talking about the state contracted Health and Human Services system.
Okay.
It's about 10% of the state budget.
Okay.
Overall, run through 10 or 11 different state agencies, including the Department of Children and Families. It's a procurement system that's managed by the Office of Policy and Management, called the Purchase of Services Procurement System, the POS system. And the Department of Children and Families, as well as DEMIS, DDS, a number of other state agencies, contract with nonprofits to deliver those services, which if the nonprofit system didn't exist, the state would otherwise be obligated through some form to deliver services to those populations.
I understand. I'm just trying to wrap my head around transparency and the fact that our tax dollars are, in fact, used for agencies such as yours. And I guess I'm kind of a little bit confused as to why there'd be a concern about wanting information about the expenditures, how it's spent. So thank you so much for your testimony today.
If I might respond, Madam Chair, I want to clarify, we aren't at all concerned at the Alliance, and our members aren't at all concerned about transparency or about sharing the information that about the programs that they do and the wonderful work that they're doing serving the kids in families that are receiving services from the Department of Children and Families. The concern is that they believe that they're already sharing that level of data and much more with the department. And to make sure that as this committee and the legislature look to streamline how that information is then shared with you or with the public, that that there aren't additional reporting requirements. We think the data that you are looking for, the legislature might be looking for, the public might be looking for, is already being submitted and then some to the department by the nonprofits that contract with them.
And so if it is, what is your problem with this? I guess I'm still not clear on why you have a problem. If it's already being submitted, right, it would just be copy, paste, and send in another column.
I think the concern is in the fact that it may not be quite so simple as copy and paste and send in the data systems that the state is using. And so, again, we don't have a problem with the bill. We're not opposed to the bill. We're just concerned that as it moves through the process, we can ensure that that what's already being collected is sufficient to produce the kind of information that both of these bills are contemplating.
Thank you. Any other questions? Emmeline, thank you so much.
Thank you very much.
Appreciate it. Ben, thank you. Next up will be Christina Bennett.
Thank you, members of the committee. I have never shared this testimony publicly before, but I do feel like it is the right time. I am here to support SB 00156, an act establishing a task force to study the voluntary surrender of infants. My husband and I went through the process to become foster parents in Connecticut through DCF, and we became licensed foster parents, foster to adopt. And one day, my husband got a phone call that there was a baby, and we were asked if we would take the child that day. I was actually traveling, so my husband said yes on our behalf. And it was actually just a couple days later, it wasn't that day, that we had a knock on our door from a social worker, and we received a baby that was surrendered at a safe haven location in Connecticut. Baby boy Doe was our child's legal name, but we were allowed to name our child. And it was a very beautiful experience, and it has been. Every single moment of motherhood has been a beautiful experience, and we have a beautiful child. One of the things that bothered me, or I just found disheartening, was when I would talk to social workers, and I can't remember the exact details because this was years ago, but they would say, oh, we're not exactly sure what to do because we haven't had a situation like this in a long time. They said that our child was the only child surrendered to this particular hospital in 15 years. And I thought, how can that be? Because I know I used to work for a pregnancy resource center in Connecticut, and I worked with vulnerable women who were making pregnancy decisions, abortion, parenting, or adoption. And so for years, actually 20 years, I have counseled women who are making those decisions in various ways. That's part of my own story. My mom had a vulnerable pregnancy with me, and she walked out of an abortion facility at Mount Sinai Hospital with me. And so I have helped women in those situations. And so I know there's many women who are facing these situations, but I wondered how the numbers could be so low. And so one of the main reasons I believe is lack of marketing or awareness, education. I grew up here in Connecticut. I went to public school here all my life. I went to Southern Connecticut State University. I graduated with my degree in 2005. And before I became a foster parent, I didn't know anything about safe haven laws, just growing up here and going to public school and going to college. And it's amazing, even with my child, how many people, when we privately share our story, are ignorant and also do not know about safe haven laws. Even public educators and people that you would assume would know, they don't know. And so I support this task force because I think that we need to educate the public. We need to have more awareness. I also want to say, too, with the issue of or the topic of race has come up a couple times. I want to say that with the forms that the biological parent or mother fills out, they can decide what they're going to fill out, and so they don't have to leave a name, so we don't have a name. But I am glad that the mother, this brave woman, put down the race, because as a child ages, they have questions, and I often looked at my child as a newborn and I wonder what race they are, because, you know, when they get older, I want to be able to explain their culture and their heritage. And so I am glad that that was there, and I don't know if that was encouraged by a hospital worker or not. I also want to just say quickly 2 more things. One, I do appreciate that this state allows 30 days for the biological parent to come back. That can be a little, you know, cause anxiety for the adoptive parents, but I think it's really good, because then you know going forward that this mother has had a month to really consider. So I think that's great. But I do think perhaps, and I don't know, I'm just putting this out there as an idea, perhaps we could consider a way for the biological parent to perhaps fill out something if down the road, maybe years down the road, they would want to reconcile in any way, that could possibly be an option if the adoptive parents were looking to do that. So I know in my case, if that was an option and a biological parent had said that down the road, 5, 10, 15 years down the road, they would be interested in checking in and possibly some type of reunification, I, as an adoptive parent, would be open to something like that. I think that's better for the health of the child to be able to have a face and a name and identity and family and everything else. So I'm just putting that out as an idea. And I also do support baby boxes as well. And I just wanted to say that as well. Whatever is necessary in order to, I think there's been 55 children surrendered through that, through boxes throughout the country. And so whatever is necessary to be able to safely surrender. So that is my story, and thank you for listening.
Thank you. Questions? Rep Paris.
Thank you, ma'am. Representative Doe, I guess, in that case. Hello, ma'am. How are you?
I'm well, thank you.
I have a comment. I just want to thank you for your testimony. This issue has now been heard over the first part of the biennium and now in the second part of the biennium, and I think it's safe to say that I'm always torn, because I'm hearing so many different walks of life and lived experiences, and I think that obviously the lived experiences give credence to what we do here in this body. One thing that is important to me that I think that you are mentioning, and one thing that I like to be on the record is as saying that, you know, wherever you fall on the line with this particular issue, either from the Republican side or the Dauphiné, don't smile at me, either the Republican side or the Democratic side, one thing is clear, is that the way that we raise children is very different in 2026 in comparison to how we raised children in 2000. The issues are far more complex. We are living in a completely different world. And so I say this to say that I think it will be interesting for us to take this task force to look on a comprehensive space and bringing partners from many different walks of life, those for the issue, against the issue, feels differently about the issue, whatever the case may be. So we may be better equipped to help have better data to know how to continue to update these challenges and update the system. And so I just wanted to put that on the record, because I have not had that aha moment yet on the particular issue. It does not mean that I feel a certain way around baby boxes. I'm still coming around to that, but I do understand that the safe surrender laws is an option that we definitely have to update, and I just appreciate you sharing that story and your lived experience with us. Thank you, ma'am.
Yes, thank you. And even as we're debating or discussing the boxes, as I said before, I think there's things that are non-controversial that we could agree on right away, like better marketing, perhaps commercials, perhaps billboards, educational awareness. I don't think anyone, that's bipartisan, right? We could come together and agree on things like that. And if I can be of help in any way, I would love to. There's more details, of course, that I can't share publicly, but I have never met another parent in Connecticut of someone that was surrendered.
Well,
An
it-
adopted parent. So I would, if I can help, I would love to.
And I think just 2 quick points on that, Madam Chair, if I might. As you talk about this, and as we're hearing, I think what's interesting about the experience that you're sharing is that you were a foster parent.
Yes.
I don't think I could ever make such a big decision on my own without consulting my wife and have her being home. So I'm glad your husband lived.
Well, he knew that we were going to say yes. We were waiting for a child, so he knew.
And I appreciate that. But as we're having very comprehensive conversations about what it means to be a foster parent in this state and how to better support foster parents in this state, we have to understand that it's not a monolith in terms of the experience for the foster parent. And so it is helpful for us to get that experience so we know how to better, I think, care for our children. Secondly, the thing that you're bringing up a really important piece, which I complain about in every committee, on every committee that I sit on. We don't do a good enough job in the state of Connecticut. And we do many things well, but we don't do a good enough job in the state of Connecticut with marketing the policies that we're actually in the legislation that we
Yes.
clearly pass.
Yes.
And part of that is that because we don't do a good job on that, many policies and programs sunset. And then we have legislators coming back again in the future trying to reenact the same policies.
Right.
And so I think if we just do well in that endeavor from the beginning, I think that we could probably start to see a lot of these programs flourish and not wait 26 years down the line to try to fix that. So I just want that to be on the record as well.
Thank you.
ma'am.
I do want to say too, it's not that, obviously, we know from a a health perspective, mental health perspective, psychological perspective, this is not the best option, obviously, for many reasons. But it is one that can provide a safe home for a child in need, and so therefore it's worth fighting for and getting right.
Representative Belton.
Hello.
Hi.
I want to personally thank you for sharing your story. I think it's very brave of you. I also wanted to ask, so you said that you support the task force and you also support baby boxes.
Yes.
Can you tell me how you feel about regulation of baby boxes?
Sure. So I think that regulations are important. I support baby boxes. I know that the one case where there was a death, that was with a child that was already deceased and was left inside of a box already. So there, as far as I know from my research, there have been no, deaths or medical emergencies with children that have been placed, and there have been at least 55 children surrendered safely. And those are really beautiful stories, and so I think that that alone is worth pursuing it. But at the same time, I don't think that it has to necessarily look the same. And so I know there is a main organization which provides baby boxes, and I think that they're doing a wonderful job. But if the task force has concerns about the way that that organization operates, or they feel like there needs to be other regulations, I think that that can be explored. Is there a way to do this, differently? Like the woman shared before, the baby boxes that are in Germany, I'm sure that the United States provider obviously did not provide those ones in Germany. And so the actual, mechanics of this, this safe box right now is, there's obviously monopoly on that from, one organization, but I support the idea of it. I do support the organization as well, but I also support the idea of it. And so if, let's say the task force said, we love the idea, but we don't like this part, and we think this needs to happen and it should be better regulated in these ways, then I would say let's have conversations about that. Because obviously the most important thing is, a woman's safety and a child's safety. But again, I have not seen any cases throughout, history in the last 20 or so years that I would say that have been unsafe that would cause me to have a great concern. Some of the things that were shared earlier about a woman needing to get resources, and I agree. I think that's absolutely important. But I also would say that let's not forget that a woman in her life is going to have a number of different points of contact with OBGYNs, community center leaders, doctors, and different people. And so it's not as if because she surrenders early in the morning, you know, to a hospital, or let's say there is a baby box and she surrenders anonymously, that doesn't necessarily mean that she was without that information and resources, because she could have gotten it at a different touch point. You know, she could have, because again, they're surrendering when the baby is already born. And so she could have gone in early to the hospital, and maybe she was planning to carry the baby and keep the baby up until 6 months. And maybe something hypothetically tragic happened at 6 months, and she said, okay, I have to make a different decision. I mean, we really don't know because we don't have information. But I think we shouldn't just assume that, okay, well, she's not getting information at this point, the point of surrender. Maybe she's gotten information prior to that. That being said, of course, you know, information is important. If there's a baby box and it has maybe something attached to it that has pamphlets and information that she can take, I think that would be great as well. So I'm willing to kind of explore what that looks like. But I will say that one thing I like about the baby boxes is just, and I know this is going to sound silly because it's not, obviously it's not the same, but you know, people are uncomfortable like returning items to the store. People are uncomfortable telling their waitress that they don't like their meal, and they're uncomfortable saying, hey, excuse me, you know, because there's just, people are uncomfortable like doing those things. And that's just with clothes and with food and with like really trivial things. But to think of going into a hospital facility and talking to nurses and writing things down, I thank God every single day that my child's birth mother had the courage to be able to walk into a facility and write things down on a paper and talk to, you know, hospital workers. But I can understand how many people would not want to do that. That would be terrifying for them. They would want to do that with, you know, complete secrecy. And I will also say, I don't know if I should say this, but, well, I won't out the hospital, but I will just say this, that sometimes even in that process where you think your information's private when you're walking into a hospital, sometimes it's not. And so I have, after, you know, my child, you know, as he's grown and we've gone to different hospitals, I feel like some information's been given to me that I thought, oh, that information was probably accidentally given to me that was supposed to be private. So I'll just say that. So therefore, there can even be leaks when you think that you've done something anonymously, but perhaps because it doesn't happen a lot, the workers maybe don't even exactly know what to do. And so things can get mixed up, and maybe records can get mixed. And so that's why I think that it is important for women who truly do want none of their information to be ever possibly, you know, given out, to have that anonymous option.
Thank you. Representative McGee.
Thank you, Madam Chair. I just want to share that someone in this building who is watching is an adoptive parent of a child surrendered through our safe haven laws. So
Oh, wow.
you had just said that you
Okay.
had never met anyone, but that just, I just had that conversation. So
Message me.
So that's why this is very important.
You can do a play date.
Rep Belton asked a really great question. I'm just going to expound upon it a little bit. Just like pregnancy centers are 100% fundraised,
Yes.
and receive no financial support from the state,
Yes.
as is baby boxes, where an organization fundraises, receiving no funding from the state. There are some states where a 24-hour emergency room nurse and security are positioned around the baby box, and they say that there has not been a baby in the country that has been in a baby box for more than 35 seconds.
Right.
Share that information because you most likely have counseled a lot of disadvantaged women.
Yes.
I know staggeringly statistics that they are likely women of color. With women in vulnerable positions like that, how do you think someone like them could benefit from this safe haven law? And I'm not, obviously the contents of this bill,
Right.
you know, it doesn't necessarily address baby boxes. We're going to explore, but how do you think women like the ones you have counseled could truly benefit from safe haven laws and or like just if there were a baby box?
Well, I think it just provides
Discussion.
another choice for them, another alternative. Obviously, we know there's only, certain choices that a woman has when she's pregnant and carrying a child. She can choose to parent that child, obviously. She can choose a traditional adoption, or she can choose something like, a safe haven. And that option is one that's, very rarely discussed, and they very often they don't have any information about it. And I think that women who do choose that are probably in the most, desperate situations. But just knowing about it, I think that it does provide hope. I think that it does provide a sense of there could be a good future for my child. And knowing that they can surrender without legal consequences, I think is something that can, put them at ease. I think that's also something that perhaps they don't know, that there's not as much, education around that. So maybe perhaps some of them don't know you can surrender and there's not going to be any legal consequences for you. But I think the main thing is that it gives them hope. There's a lot of fear when a woman is facing a pregnancy, especially if it's unplanned. Sometimes there's coercion from partners, perhaps to choose. And when I was working for a pregnancy center, but even now, a lot of the women that I worked with who were contemplating abortion, for example, many of them were feeling coercion from partners, male partners pressuring them or saying, you have to do this. And they often didn't know what to do or who to talk to. And that was the case for my own mother with me when she was pregnant with me. That was her situation. She was being coerced and pressured as well. And so, again, this is an option, though it's not perfect, that I do believe can give women hope to know I can do this. And I can surrender my child, and my child can be safe and possibly provided with a beautiful home.
Representative Pizzuto.
Thank you, Madam Chair. Just to give you a scenario, I appreciate your testimony and what you've done. I'm very proud of that. If the birth mother decides before the 30-day period to want the child back, and then along the way life throws more angst into her life and gives it up again, does that go to a new parent or back to you as another option? I would be building a bond with this child.
Really good question. I actually don't know how the foster and adoptive, I don't know how DCF would handle that. So if we were placed with a child, and let's say we had the child for 20 days, and on day 20, the birth mom comes back, I don't know if the state would then place us later with the child again. I'm not sure. I mean, I think that would be good because there was an initial bond, but then I think it depends on how long it's been, because I know that the state really likes to place with family members, and so I would think that if a child went back to bio parent, and let's say they grew up with aunts and uncles and everything else, I would think it would probably be better for that child than at age 5 or 6 or 7 if they have established relationships with aunts or uncles or someone else. Probably DCF would be thinking that it'd be better for that child to go to one of those family members if they were open to adopting than to someone who had them for, just for those first 20 days. That's what I would think.
Well, the child is fortunate to have you in his life. Thank you.
Thank you.
Representative Dauphiné.
Thank you, Madam Chair. Christina, thank you so much for being here. I have had the honor and privilege to hear you speak many times. Be
Thank
still
you.
my heart.
I never shared this one publicly, but I think it's time. Thank you.
And you have also shared your personal story with your son with me. So
Yes.
I know that you have concerns about coming public with that. So I so appreciate you being here today.
Thank you.
And you've been a huge advocate for women who are distressed in pregnancy and looking for answers and looking for support. And I want to thank you publicly
Thank
for
you.
that as well.
Thank you.
I do have one question, though. I look at the baby box opportunity as a last ditch effort, kind of, right? No, none of us want, we will all want our mothers taken care of, counseled, followed through their pregnancy. Ideally, I want that for them.
Right.
But we know that there's women in situations, and as you described, that probably aren't going to seek that out.
Right.
And so I look at it as like the difference between putting my baby in a dumpster or putting my baby in a baby box.
Right.
And that's horrific, right?
Yes.
I get that. But if we have an opportunity to save a life, and you described, I think it was you who described the hospital being willing to cover the costs and take on all of that. So I guess my question to you is, why do you think anybody would oppose that? I mean, we're talking about kind of a last-ditch effort, right? So maybe you could share that with me.
So
and
I
us.
think that there's different reasons that people oppose it. I think that there's misconceptions, for one, and a lack of information and education about the boxes and how safe they are and how successful they've been across the country. So that's one. I also think that sometimes there's just biases that people have. And sometimes that can be connected to politics. And again, that comes with misinformation. And I've experienced that a lot in the work that I do, just being kind of a victim to people's ideas about who I am and the work that I do and what they think that means, and making strong judgments without really understanding me and my story and why I do what I do. I think it also comes from I will say also, I'm sure that it comes from a pure place for some people of just wanting, like you said, the best, and I think we all can agree on what the best is. Of course, if a mother wants to make a plan for adoption, it's wonderful if she can sit down and make a plan with someone and maybe even go to an agency where she can see beautiful pictures of families and get to decide and have an open adoption. I think those are the best, and she can write letters back and forth. But unfortunately, we do live in a world where many of us turn on the news and we hear really horrific stories, and they're happening. They're happening all of the time across our country, where people are afraid, and when they're afraid, they do really scary things, and they abandon their children in really horrible ways. And so because that's our reality, I think we have to be willing to take risks and to do things that perhaps people find controversial, but of course discussing them and having safety standards as well. But if there are 55 children in this country who are alive and whose parents, surrendered them through safe haven boxes, and they are thriving and they're in families. I mean, I think about our one child and the difference that's made in my life. And so 55 children, I mean, that, those are, in my eyes, large numbers in light of what we're talking about. So.
Well, thank you again for being here today. Your son is amazing. He's beautiful, and he's sitting back there being so quiet.
He's done.
So we appreciate that.
I promised him chips, actually.
Yeah.
I said, if you just,
He's got the best mom, and I want to thank you again for all you do.
Thank you so much. Thank you all for listening.
Thank you. Next up, Merrill Gay, please, from the Connecticut Early Childhood Alliance.
Good afternoon, Senator Marr, Representative Paris, members of the committee. My name is Merrill Gay. I'm the Executive Director of the Connecticut Early Childhood Alliance, and I want to thank you for this opportunity today to speak in favor of House Bill 5163 to establish a task force to study ways to make things more affordable. We have a real affordability crisis in this state. The two biggest expenses are housing and childcare. Those expenses have outpaced the national inflation rate, and we are now seeing a growing number of families falling below the United Way ALICE survival threshold, meaning that they don't have enough money to afford the basics. Not thinking about saving for a vacation, we're just talking about the basics. And that survival budget is higher than our current child care subsidy income limits. So there are lots of families, and I will always remember the woman who called me up and said, I'm waiting to find out whether or not I'm eligible for Care for Kids. And I asked her a little bit about her situation, and it was like, I'm paying half of my paycheck to pay for child care. I'm hoping they're going to come through with some help. But the other half I'm using to pay my student loans. And if his dad wasn't working 2 jobs, we wouldn't have a roof over our head. And I was like, wait a moment, you've got 3 incomes coming in. You're not eligible for Care for Kids. That was her story. We have since made it a little better so that parents don't have to wait to find out if they will be eligible for Care for Kids. You don't get placed on the wait list until you have been deemed eligible. But we now have about 3,800 children on the Care for Kids wait list. The people applied way back in May, and we're still we have a wait list that long because we don't have enough money to provide those subsidies. And then, of course, there's the whole issue of all the people above that income above the Care for Kids income threshold of 65% of state median, but below what it actually costs to live here and pay for care. So what we're seeing is lots more families or couples putting off having children. And from a macro perspective, that's not good for the state's economy. If we have more people aging out of the workforce than we have coming in, we can't sustain the current workforce. So I just want to thank you for introducing this bill, and I hope that we can see it move forward and make some progress. Thank you very much. Happy to take questions.
Thank you. Representative Paris.
Thank you, Madam Chair. Meryl, thank you for your testimony, and I think that you hit a lot of solid points and valid points right on top of its head. One thing that I think everyone here can clearly agree on is that poverty and high cost of childcare and high student loan repayments and the lack of affordable housing and affordable housing not in the sense of federally mandated affordable housing, just being able to afford a home, that none of those challenges discriminate against a person because of where they live in our state, what they look like, who they are, what jobs they have. Everyone is facing that struggle. And I know it's difficult when I had a separate work meeting last week in Darien, and I had a businessman in Darien say to me, Darien's changed an awful lot. And I said, well, what do you mean? And he said to me, it used to be that all of the wives came from these high-powered careers, but when they moved to Darien, they would stay home, and the husbands would be the only ones to work. And now you see that even in Darien, most people have to have 2 to 3 jobs just to keep up with the pace of living. So I can only imagine what that's like in Representative Wielander's district or Representative Dauphine's district. And I want to make sure that young families, especially around these issues, stay here. So I appreciate your testimony. I hope that this, once again, is a bipartisan effort in the House and hopefully, therefore, in the Senate. And I hope that we can put together a task force of subject matter experts that can help us to eradicate poverty in our state so that we will be able to have a stronger state in the next few years. Thank you, sir.
Thank you.
Representative Wielander.
Thank you, Madam Chair. Thank you for being here. It's nice to see you again. I guess I have a question and a comment. Looking at it's a pretty comprehensive list of the people and agencies that might be, are being suggested as being included on this task force. Was there any other perspective that you think might be missing from this? Or do you think it's with the Commissioner of Social Services, Children and Families, Childhood?
So I think my question would be really, this will require some analytic work, and the question of, are we expecting the state agencies to just sort of donate that in kind, or is there some source of that kind of support to do things outside of what state agencies are typically doing?
That's a good point, and I think all of the agencies would probably appreciate you mentioning that. But I just wanted to, my comment is I appreciate very much the fact that you made note of the gap that many families are falling into, and individuals, of you're not at the poverty line, but you are not succeeding, and you're not able to prepare for the future and stability that way. So, the Alice Mark is a great one, but I think there's just thinking about that as a broad swath of individuals, how many more people are falling into that category these days, and it's more and more and more. So I think it's really important that we highlight that, because those are a lot of times the families that aren't captured by data, that are often very reluctant to ask for assistance, and yet are a vital part of our communities and every single small business and economic impact that they have. So thank you very much for that, just making that note. And that's all I have. Thank you, Madam Chair.
We frequently forget that families are at their lowest net worth in the first 5 years after the birth of their first child. And that time, folks don't have a lot of savings to fall back on, and it's virtually impossible to live in this state on one income. It's, when we think about the Care for Kids caseload, we are typically thinking of single parents, because if you have two parents working full-time, they're over income, and yet they're still struggling to be able to pay the basic costs. And we are actually now seeing nationally a decline in the number of parents paying for childcare, because they have concluded, I can't afford to do this anymore. More and more, what we hear anecdotally from childcare programs is that the birth of a second child means that parents are pulling out because they can't afford that cost of the second childcare expense. That's more than rent or their mortgage. And so we now have this real challenge for families. And so, you took a big step forward with the creation of the endowment to get to a point where we will have more affordable childcare. But there's going to be a few years before you have enough money in that endowment to really make a difference. And so the current situation with Care for Kids having such a long wait list is a big problem that is causing lots of trauma for families who, if you're thinking that you're going to go back to work but you can't find childcare, it's a real struggle.
And just thank you for granting me the indulgence of a follow-up when I said I was done. I can't agree with you more, because we have 3 kids, my husband and I, 2 years apart. I stayed home for 13 years because we could not afford childcare. And I think making sure we also know that this is now a generational issue, because if you are not able to find or access, even if you can find childcare but you can't access it, or the systems that are meant to help are not working the way that they should, that means that you aren't generating income. Most likely women are the ones who stay home. So that means personally I have 0 in my retirement account, or not 0, close to it. And I'm relying on my husband to, maintain that for ourselves. So it puts me in a more vulnerable position, and other women in a vulnerable position later in their life. We are not, when I was home, it was great, but we weren't able to put aside money for our kids to go to college. And now with the federal changes, where they don't take into consideration what you're paying for other children in your family for what you supposedly can afford for the next kids, it's really hard. So if a family is able to access a system that was created with great intent, like Care for Kids, like the endowment, if they're able to access that, it doesn't just mean that the families can pay less in childcare. It means that they are actually able to set themselves and their children up for more stable futures and more access to opportunity for betterment for themselves without burying themselves in debt or missing out on opportunities. So just wanted to put a button on that. Thank you.
Okay, thank you.
So if I might just also add on to that, it also is better for employers, because employers don't know whether at the end of medical leave, family and medical leave, if the parent is going to say, oh dear God, I cannot do this. I cannot go back to work. So making sure that we are offering opportunities for reasonable childcare. I know that one of my grandchildren is in a $2,400 a month childcare. It's incredible. And that is just not sustainable over time. So it's an infrastructure issue, and that is how we need to all be looking at it. Thank you. Thanks so much for your testimony. Next, we have Elizabeth Simonetti.
Thank you, Madam Chair. Thank you, Mr. Chair. I very much appreciate, and I'm speaking on behalf of 156, which is to establish the task force for looking at voluntary infant surrender. I guess I have 3 blocks for my testimony. The first is, once again, to say thank you, because this issue really hit home earlier, well, in the spring of last year, when we had a woman who unfortunately drowned her infant in Wilton, Georgetown area, rather than going to a facility to surrender the child in person. And so it just really underscores the need for looking at this issue and to look at first safe haven laws and to look at other ways, excuse me, to look at other ways where we can support women in crisis in their surrender. The second component is I'm going to just give you the bullet points from my testimony last year about the baby boxes, only because we've been there, we've plowed those fields deeply last year. So the baby boxes are certainly a nonpartisan issue. This is not a left-wing, right-wing issue. This is a child that's already been born. So second of all, there's no funding associated with the baby boxes, not from the municipality, not from the state, and not from the federal. These are community-driven, as Ms. Bennett said, these are community-driven initiatives. Third, it's just baby boxes are an option to expand the use of technology as we look at the safe haven laws. And I think we're all agreed on that. And the support that women receive from the 1-800 numbers and the online support from the Safe Haven baby boxes really goes the continuum of well before you deliver, through delivery, and postpartum as well. So the third and final component of my testimony follows on to Representative Paris's, your comment about lived experiences. And I think the makeup of the task force as it is proposed is brilliant. But I'm going to throw a couple of more folks into the mix for your consideration. The first is the family that was sitting back here earlier. Erica Maver is an emergency room nurse at St. Francis Hospital. So she's dealt with the women in crisis. She's dealt with the handoff. She's dealt with what do you do and the interface with DCF for the adoption. And she has a wealth of experience, and I highly recommend to consider her. The second is a woman who testified last year, Melissa Ravicki. She's a labor and delivery nurse supervisor at John Dempsey Yukon Health Center. Once again, works with the Gen X and Gen Z moms who are in real crisis during labor and delivery. Once again, that lived experience is very important. And the other group that I've started speaking with are the firehouses. I've spoken with the former fire chief in New Haven about this, only because we talk about hospitals, we talk about police departments, we talk about firehouses. And so they would be a very important component to include on the task force. The man that I spoke with, the former fire chief, is Martin O'Connor, and he was very neutral on this subject because he had a lot of different variables that he's balancing and juggling as he's sending out crews for 911 calls. So in conclusion then, I would very much, as I say, I'm very much in support of this task force. There's a bunch of us that are ready to be able to provide any background that the group needs. And as I say, to look at expanding the group a little bit with some lived experiences. So that's the end of my component, and I appreciate the time.
Representative Paris.
Thank you, Madam Chair. Dr. Simonetti, I hope that you will allow for me to ask a question, but the question that I'm asking is for the clarifying purposes of the public viewing of this public hearing. Just for people at home, ma'am, if, and this can be discussed, let me also say that this can be discussed in the task force. I want to remain germane to the bill and concept, proposed bill at hand. So with regards to the task force, one thing that I would like for us to explore, it would be understanding why there would need to be state approval for a privately owned hospital in our state to include these baby boxes. And I think that that is a conversation that many people in the public don't understand. And so if you could give us, from your perspective, ma'am, why that is needed for state approval, it would be helpful for us so that we know to flag that with the task force.
I'm super glad you asked that because it all hinges around one word, and that word is anonymity. It's the anonymous surrender, the anonymous voluntary surrender that is separate from infant surrender in the current safe haven laws. And it wraps around, you have to have the anonymous in the law in order to install baby boxes anywhere in a state. It's that word.
So if I may, and please know that I'm not getting cute with you. I really am trying to understand this.
Sure.
If I go to Stanford Hospital, which is an independent hospital, but if I go to Stanford Hospital and you mean to tell me that Stanford Hospital would need state approval in order to add these boxes, these baby boxes, this wall, into their hospital because it would need to be anonymous, correct?
Exactly.
May I have a follow-up question, Madam Chair?
By all means.
Thank you. So wouldn't, I guess when people are dropping off the boxes, and I'm really trying to understand this, when people, not dropping off the boxes, excuse me, when people are surrendering the baby, would there be no cameras in the space, in that room, for them to surrender the baby and place a baby in one of these boxes?
Yeah, there are no cameras, and that's the key. Somebody brought up that it was misinstalled somewhere where there was a camera. There's no cameras around the box or in the box or on the inside in the firehouse, for example. Yeah.
Okay. I just wanted to know for clarification on that piece, because if I were regular Joe Schmo, and as legislators we don't know everything, so I think that your perspective is helpful. But just from the onset of this, I would think that if Yale Hospital wanted to install these, that they could without having state approval and supervisory privileges getting involved. I think it would be something that the state wouldn't need to get involved with. So what you're sharing with me is news to me, and I think obviously something for consideration during the task force. Thank you, ma'am.
The other quick thing I just want to point out for the task force in the future, April 4th is actually Safe Haven Day.
Okay.
And so I would like a group to work with to make it this educational outreach awareness campaign that so many of you have already discussed. Last year, I reached out to the Hospital Association, and they had a transition in staff. So I would like for the task force to recommend a campaign, outreach, awareness, campaign for safe haven laws across the state.
Representative Dauphiné.
Thank you, Madam Chair, and thank you, Representative, for your good questions. They were very insightful. That was something I didn't know. I wondered too why we needed to address this legislatively when there's no cost to the state and the hospital volunteers that. I think the anonymity part that you talked about, so this would really be the only alternative to be completely anonymous. Is that correct?
That's exactly right.
Okay.
And that's what sets this apart from all the other fabulous ideas that folks have already shared. You know, even having the 911 meet you at a location to hand over. That's not anonymous. And there are, unfortunately, women that it's just a bridge too far, as somebody pointed out, that you don't want to send your meal back to the restaurant. You don't want to, and that would be the last thing that as a woman you would want to do.
Right,
Yeah.
and I think probably the shame, perhaps, and as awful as it is, maybe that's why some of them may do other alternative things, putting their baby in a dumpster or taking the life of the baby or having some severe depression and just not wanting anybody to know. So I appreciate your testimony today. Thank you.
Thank you.
All right, thank you very much.
Thank you.
Next, we'll have Randy Collins from CCM.
Good afternoon, members of the committee. My name is Randy Collins, Associate Director of Policy for Connecticut Conference of Municipalities. And here today to testify on Senate Bill 157, an act concerning municipal camp safety. We will be submitting written testimony later. My coworker was caught out of state, so I'm pinch hitting, so I will do my best for you today. CCM has no objections to Section 1 regarding the inclusion of mandated reporters. We actually feel current statute already covers these positions under CGS statutes 17A 101, which lists all paid staff, paid youth camp directors, associate directors, and employees over the age of 21 to be mandated reporters. If this new language clarifies, we're fine with that. In regards to Section 2, we're happy to work with OEC. We did have a conversation with them earlier to gather that information and to figure out exactly how that would be facilitated between CCM. I don't want to speak for cost or CRPA, but you know, we look at it one of those of if the committee asks us to find that information, we'd certainly work to do that. I don't know if we actually need a law to do it, but if that's how the path we go, then so be it. We're happy to comply. So as I said, we're happy to be able to support what's currently in this bill and happy to take any questions.
Representative Mastro Francesco.
Thank you, Madam Chair. CCM, Connecticut Conference of Municipalities, what you're testifying is in favor of the entire bill as it's written.
We don't have an objection. As I said, we look at 17, you know, the mandated reporter section. We believe we already comply with that or already covered under that. If it just clarifies to make sure that it makes it a little simpler. If somebody is not, then we're okay with that. In terms of looking at identifying more information on existing youth camps, I think we'd be happy. Again, we're not afraid of providing information. I think we'd be curious if it got too onerous in terms of administrative burden on especially some of our smaller communities, but I think we can work with OEC to kind of compile that. I mean, OLR could reach out, and they reach out very often on different questions.
Right.
So we'd be happy. We're not going to argue against finding information. We have nothing.
Thank you. Yeah, because these bills start off with this particular language, and then before you know, by the time it comes out of committee, it could mean more. And I remember a bill last year that the municipalities were not necessarily in favor of when it came to camps. And I'm just curious, when you testify before us, you represent Connecticut Conference of Municipalities. How does the municipalities work with you? When you testify in favor or against something, is it the will of the mayors and first selectmen in town who have solicited your organization to say, yes, we're in favor of this, and yes, we're not? Or is it more of just a committee that you guys put together for CCM that kind of makes the decision within conversation of the municipalities?
So typically, we have, if it's an issue that is a new issue that we haven't had conversation on, that we haven't seen before, we'll highlight that at one of our monthly legislative committee meetings, of which every member, we represent 167 of 169 municipalities. Every member of ours is a member of that legislative committee, is invited to, and we raise new issues and seek the guidance from the members. So if there's something that we're really split on, we won't take a position. Often, the legislation is similar to what we've seen in the past, so we'll have guidance of where to go. So we don't have to reach out and pull members on, because you guys are very active in in raising bills and concepts. So a lot of times we know where our membership is, but if it's a new issue, we do certainly bring it before them, and that's how we get our guidance.
Okay, yeah, thank you for clarifying that, because it's interesting when I see organizations come up, it seems like there's only a few people making the decision, but you're actually getting input from the municipalities. Not necessarily from the people that live in that town, but maybe the mayors and the first selectmen. And it's not necessarily all of them. I can see a couple issues that maybe passed last year, like the housing bill that CCM was in favor of, but maybe not all the mayors or the first selectmen or the people in the community weren't. So I was just really trying to understand where you're coming from and how you represent your
usually
municipalities.
our issues, I mean, for us, because in the end, the partisan issues don't necessarily, at the end, our mayors have to balance their budgets at the end of the year. So most of our issues, I think I've only seen actually a hand count on a select number, one or two issues over my 13 plus years now within CCM. I think one was tolls. I think another one was, we were close to counting on a post-Sandy Hook on some of the gun control issue pieces. But other than that, generally, there's broad consensus. And if there really is a divide, we'll table that issue or take no position because of the makeup. But I mean, I like to think of our membership representative is very similar to where the legislature is in terms of Republicans, Democrats balancing urban, suburban issues.
Okay. Thank you very much for the clarification. I appreciate your testimony today. Thank you, Madam Chair.
Thank you so much. We appreciate you being here.
All right. Thank you.
Next, we have online Kathleen Callahan from the United Way of Coastal and Western Connecticut.
Hello. Hello, honorable chairs, ranking members, vice chairs, and all other members of the committee. Welcome back, and thank you for your continued leadership and commitment to Connecticut's children and families. My name is Kathleen Callahan, a resident of Stratford, and the Director of Policy and Civic Engagement for the Connecticut Cradle to Career Coalition. I submit this testimony on behalf of the coalition in support of HB 5163. And thanks to all the speakers and this discussion today, and for my testimony to Merrill. I'm going to add to that a little bit. This bill creates an opportunity to examine affordability, not as a single issue challenge, but as a systems challenge. As the task force undertakes its work, we encourage an integrated approach that examines youth and young professional workforce pathways, particularly in high-needs sectors such as early childhood education, healthcare, and advanced manufacturing. Affordability improves not only when cost decreases, but when young professionals can access stable, upwardly mobile careers in sectors where Connecticut has sustained demand. That includes programs that connect education, credential attainment, and unpaid work experiences to long-term earning potential. For example, structured earn and learn pathways where students obtain stackable credentials while completing paid placements allow young professionals to reduce debt, enter the workforce earlier, and progress along predictable wage ladders tied to credential growth. As Connecticut stabilizes our early childcare and education system, the impact on affordability across the economy is an important metric. When workforce pipelines are aligned with public investment and compensation policy, we reduce turnover, stabilize care supply for families, and improve retention for employers, things that were just discussed. We encourage the task force to consider how stabilizing any essential infrastructure system, early childhood, healthcare, transportation, housing, has measurable downstream effects on affordability. And one more thing, we also respectfully request that youth and young professional representatives be included in the membership of the task force. Individuals directly navigating affordability challenges bring essential perspective to policy design and implementation. This bill, HB 5163, presents an opportunity to articulate how system stability, workforce alignment, and economic competitiveness reinforce one another. We appreciate the committee's leadership and strongly support this bill. Thank you all.
Seeing no questions, thank you so much for your testimony and for hanging in with us today.
Absolutely. Thank you all.
Next, we have Daniel Fitzmaurice, also from the United Way of Connecticut.
Good afternoon, everyone. My name is Daniel Fitzmaurice. I'm the Director of Advocacy at United Way of Connecticut, speaking in support of Senate Bill 154, which is an act requiring certain agencies to report costs associated with programs serving children and families. Our latest ALICE research quantifies the growing affordability crisis in a number of different ways. ALICE is an acronym that stands for Households Who Are Asset Limited, Income Constrained, and Employed. Overall, more than 581,000 households across Connecticut cannot afford their basic necessities right now. That's the highest number we've ever recorded, and this growth is not confined just to our cities. We're seeing sharp increases in suburban and rural communities as well. But in 2022, our national ALICE research partners published a special research report on children across Connecticut, which I did include in my written testimony. At that time, the federal poverty level for a family of 2 adults with 2 young children was $27,000. But the bare minimum cost of living in Connecticut, which we call the ALICE threshold, was $108,000. That's the central problem this bill seeks to address. We can't expect families to climb the economic ladder if our public policies only recognize crisis-level financial hardship. Economic mobility starts with honest benchmarks that this bill helps us consider. This report also quantifies a baseline for understanding about this issue. So while 12% of children at the time in Connecticut were officially under the poverty line, another 32% were growing up in households that were above the poverty line, but still unable to afford the basics. So altogether, that's about 44% of children in our state living below the ALICE threshold. This report also addresses a very common misconception. These families are working. In fact, 95% of children below the ALICE threshold live in homes with at least 1 working adult. Even in households with 2 adults working, 39% of children are still well below that threshold. Senate Bill 154 takes a big step forward by asking these agencies to examine the cost and eligibility through this lens of the ALICE threshold. And aligning our policies with the real cost of living will strengthen economic mobility and make sure that children are not locked out of support simply because our benchmarks are a little outdated. We stand ready to support with data, technical assistance, and anything we can do as this requirement moves forward. Thanks so much.
Thank you so much. Looking around, I do not see any questions, so thank you also for staying with us and for your testimony. We have 2 more speakers. I know you only have 1 speaker on the list, but due to some glitches in our system, we did allow for 1 person to add in. So 2 more people. We have Shannon Lane next, and following that, Janice Fleming, and then that will be our public hearing.
Hi, thank you so much. I had a joke about being the last person, and now it's not relevant anymore. Senator Mar, Representative Paris, and committee. I am here to speak about Senate Bill 157, an act concerning municipal camp safety. I'm the director of the Nancy A. Humphreys Institute for Political Social Work at the University of Connecticut, but I'm not here today in my official capacity with UConn. I'm here because I'm a social worker and I'm a parent of 2 young children, and I live in Bethany, Connecticut. It used to be when I said Bethany, people didn't know where it was, or they thought it was a beautiful rural place. And I see some head nods that maybe you think of other things now when you think of Bethany. I'm so grateful that this committee is raising a bill to address the safety of children in municipal camps. I hope that you will take this opportunity to strengthen the ways in which we make the kids in our municipal camps safe. Like many parents, I had no idea that municipal camps were not subject to regulation and oversight in the way that private camps in the state of Connecticut are. I found this out nearly 2 years ago when a Bethany Parks and Recreation employee was arrested for assaults against children in our town that go back as far as 2022. I imagine most of you have read the report that came out that is available on the Town of Bethany's website. It's also linked in my written testimony. The report from Pullman and Comley outlined a number of ways that more oversight could have protected the children of Bethany. The arrest of the town employee who was accused of these assaults didn't happen because of mandated reporting. It didn't happen because of any action by adults who were employed by the town of Bethany or the state police. It happened because of the actions of some really brave children, young women, and their very brave families who have supported them in bringing charges and advocating through the legal process that continues today in 2026. It is not yet resolved. I would love to see the legislature address the oversight of municipal camps more directly. I do think it's a good start that the bill under review today increases the number of people who are mandated reporters, and I was really glad to see that the proposed report is a collaboration between the Office of Early Childhood and statewide organizations, because I think in the bill that was raised last year, that collaboration wasn't present, and so a lot of the things that advocates were hoping for that maybe towns felt weren't possible, and that conversation didn't happen until the bill was being debated on the Senate floor, towards the end of the legislative session. I also know that it's so important to all of us that municipal camps are available to kids and families that don't have the resources to attend private camps, and that whatever we do to protect the safety of kids in municipal camps, we need to make sure that that doesn't make those camps so expensive that then they're no longer available to Connecticut families. All of the kids in Connecticut, whether they're going to public camps or private camps, whatever resources their families have available to them, all of those kids deserve to be safe, and they deserve to have access to good, safe, quality care. I think this bill is a good start, but it doesn't look to me like it encourages collaboration between these stakeholder organizations enough. And it doesn't look to me like it really provides the oversight that I, as a Bethany parent, would have wanted to see in my town over the last several years, and that I know other Connecticut parents would like to see in their towns. So thank you very much for the time. I appreciate your time. I'm happy to answer any questions.
Thank you so much. We definitely can nod our heads at the mention of the name Bethany. I do want to ask a question. When you say that it does not, you don't feel this bill works towards collaboration in a way that you think we could actually do, I'd love to hear from you. But I also am looking at the testimony, and I don't see your testimony posted up here.
I did it sort of at the last minute.
That's fine.
I
Just
testified
wanted to
in
make
front of
sure-
higher ed today too, so it's been a
Thank
day.
you. Just wanted to make sure we got it.
Yes.
So when you speak towards collaboration, could you say a little bit more about that? Thank you.
So one of the things that struck me last year when I was listening to the Senate debate on this topic was that there seemed like there was a real disconnect between what municipal camps thought they could do and afford, what towns, particularly small towns, thought they could do, and what the bill that was written last year asked them to do. One of the challenges, I think, was that bill, in my understanding, just sort of tried to take the whole private camp regulation process and just apply it to municipal camps. But there are some real differences between those, right? Municipal camps are often run in schools, which are not necessarily set up for camps. We're adapting, school in Bethany, where It's an annex, like the annexes that we used to have when we didn't have enough room in our school. That's actually where we run our Parks and Rec program. And so those aren't set up in the same way that the JCC of New Haven is set up to run a summer camp, right? And so I think I would love for this committee to encourage, the small towns, CCM, the Parks and Rec Association, and advocates for children to come together and talk about what are the most important things that we think will make kids safe. Is it necessarily how many toilets there are per every 50 kid? If that's not on the top of the list, and that would be really expensive, I think we can all probably agree to move that down the list. Is it not just mandated reporter, but really good mandated reporter training? I'm a social worker. I've been through mandated reporter training many times. You can get really good mandated reporter training. You can get really not good mandated reporter training. But also, are we making sure that in Bethany, the person who was alleged to have committed this crime was regularly left alone with young children with no oversight. And there was no process in place for once children came forward for him to be removed and for parents to be notified. And that's part of the reason that these crimes, as alleged, could go on for as long as they did. And so I would love to see more of that present in a way that takes maybe a little bit more active stance towards making it clear what we expect the towns to do.
So thank you, social worker to social worker. Yes, I appreciate your focus on collaboration. I think that is really important. I do think that what came out of last year's bill was an understanding. Going into it, I think some of us had a pretty good idea that what a Parks and Rec camp looked like was perhaps different than the JCC of New Haven. However, we learned way more last year. So that's why we're looking at this as a task force. And to your point about the number of toilets, that certainly is a conversation about the toilets, the off-site room for a child who is sick. All of these components were discussed. So looking at the task force, what we need to do is get that landscape, because we can't start writing legislation without the landscape of what do municipal camps look like. And they do they're organically grown in many cases. We need to understand all that before we move forward. So mandated reporting, I hear you, but there are lots of different ways, but to make it more accessible and not financially impacting a municipality, we can go with online, free, mandated reporting training and require that. So anyway, thank you so much for your comments, and Representative Wieslander.
Thank you, Madam Chair. Thank you for being here. I was nodding because I live in Orange, so my family is part of the BOA Amity District, Bethany, Orange, Woodbridge, and Amity, so BOA. And it's been a really hard couple years, and I know for families, I can't even imagine what some of the families have been going through. But just hearing about it has been heartbreaking. And I really wanted to thank you for bringing up the point of the quality of mandated reporting, but also making note that this came forward because of the kids and not because of restrictions or policies that we had put in place. So if we are going to, and this is my opinion, I feel like if we are going to be able to try to serve the camps and the families in the best way possible, it has to be a combination of regulations, putting in place expectations, but also best practices. One of the things that I heard last year, I think listening to the debate on it, the bill, was the phrase, well, we already do that. We already do that. It was like, so, okay, so we've got some really great camp programs, municipal camp programs, park and rec programs that are doing some practices that everybody should know about. Not being left alone with a child. High fives and fist bumps are okay. Hugs should be, aren't or should be discouraged and you can't sit on anybody's lap. You can't, things that the same way we sometimes assume as parents that every space that our kid is operating in or that our children are in will operate in the same way. We can't assume that they all have the same instruction on best practices. So even if there's a difference in licensing or the difference in some of the training, there's still ways that we can incorporate good, smart actions that don't cost anything, but that provide a better chance of safety for our kids. And that the other, say, for example, mandated reporters in this space know what that means, that they know, how to spot certain things. So I thank you for bringing this to our attention again, and for this feedback. Hopefully the task force does allow for more information to be combined so that we can try to prevent this again.
If I could just add to that, Representative Wiehlander, the other people that I think might be good to have at the table are our schools. One of the other hats I wear is that I sit on the Bethany Board of Education, and after everything that happened with Parks and Rec, our school instituted a really phenomenal program through our social and emotional learning existing programs that taught kids in an age-appropriate way about safety. And I think our experience in Bethany is not unique in that often it is that kids have to come forward because people who groom kids are very good at grooming kids, and they're very good about grooming them when there are no adults around. And so to work that into the school curriculum, that kids know what's appropriate and what's not, again, in an age-appropriate way, and that they know, we also, in our school, we ask every kid if they can identify a minimum of 2 trusted adults in the school that they would go to if they needed something. And so I think building that trust for kids and building their own skills in advocating for themselves, I think, and that's not necessarily something that I think is appropriate to happen at camp, but if it is happening in schools, I think it has a lot of potential in these other areas.
I agree, and that's something, when I worked with Sandy Hook Promise as a Promise leader, and the 2 trusted adult thing, it's really important to have that conversation so you can identify it. So you're not, in that moment, you're not thinking, who do I talk to? Which can often lead to silence. Yeah. So thank you for bringing that all. And I think all of our kids are operating in so many different areas between school and camps and activities and sports and, church programs. We have to make sure that it's a broad approach. Yeah. So thank you. Thank you, Madam Chair.
Thank you. Seeing no other questions, we appreciate your time.
Thank you.
Janice Fleming.
Thank you. Good afternoon, Madam Chair and Representative Perez and other committee members. First, I want to thank you all. Last session was the first time I heard of this bill, and you all trying to work through safety boxes and figuring out how pass-ons for children can be done in a safe way. And I had all of these things I wanted to say, but after Ms. Bennett told her truth, it became very important for me to tell mine. In 1991, I lost my mother to an aneurysm, and months after that, I lost my father to AIDS, and then a year after that, I found myself pregnant. And I was the second oldest of 6 children, and I didn't know what to do. I knew I didn't want to have an abortion. But here's why. Sometime being seen and understanding that culturally, Black people, Black women may be a little different. I had no access. I had no one talking to me about it. Nobody was ever even talking about adopting Black children. The only access we had to public health at that time was Planned Parenthood, and the only thing they talked to us about was abortions. I never had children after that. I was busy raising my siblings, and quite frankly, I was afraid, because oftentimes the women from my community that had abortion, it wasn't that we didn't want our children, we couldn't afford to have more children. Many of us was raising our siblings. Many of us, as then, still now, are dealing with addiction, mental health, lack of access. Thank you, Rep. McGee, because there are differences. Right now, when we're talking about maternal health and everything else, we have to look at how it's impacting Black women and its numbers. I would assume that we don't know those 100 because when we find out who they are and why this started, we have to deal with all of the issues that Black women are facing as it relates to public health. To me, I don't know why we would be arguing about trying to figure out how to make sure a baby is handed off safely. It's confusing to me because I actually come from the era in the community where babies were in dumpsters, on the side of dumpsters, left in crack houses, left in hallways, pissy hallways. This isn't a figment of my imagination. This is something that I live. This is something that I know. This is something I know to be true. And so we should be trying to figure out how to save children. I can't deal with the fact that oftentimes in this building, I'm a lobbyist, but I'm here personally. I have no clients on this bill, but I'm passionate about this. That sometimes when bills will benefit the residents of the state of Connecticut, we get caught up in R or D. Is it a Republican bill? Is it a Democratic bill? Is it a Republican bill? Is it a Democratic bill? And I get the politics of it all. What I don't get is that we lose our humanity when we don't take a step back and not make this about whether it's the right or the left, but we make it about children. Children. 55 children have been saved because of a box. I don't care if you wrap the baby in a blanket, a box, but if there's an opportunity where you have an option, I didn't feel like I had an option. No one talked to me about adoption. And let's not act like that's still happening. In our communities right now, Black women are still not being talked to about perimenopause, adoption, any of the things. Thank you, Rev. Belton and McGee, for raising these issues around our public health. It is so critical that we open our minds, right? And see that we have to figure out how to give young women, immigrants, everybody the space to make a decision that they want to make. I did not want an abortion. I had no other no one presented me at 17 any other options. No one said that they were going to adopt the Black baby in a project whose father died from AIDS, whose mother died from no one. We're talking about still to this day access. So marketing, right? I see the billboards. I see billboards for something I'm already familiar with because they was already in my community. Planned Parenthood, baby, that was the only health care we got, and that was about abortions. They didn't even do physicals. It was strictly about abortions. That was the only choice I thought I had. No one gave me another choice. And I always wonder, like, if I wasn't so traumatized at that moment, had I wanted, would I have wanted children? After that, I decided I didn't want children. Maybe I did want children, but it was so traumatic and I was so confused and I didn't have my parents, right? I'm not the only one who doesn't have their parents at a young age. These are not decisions only adults have to make. These are decisions that young people who have no parents have to make. These are decisions that women have to make, young girls have to make that don't have access to health care. Right now, you got a whole bunch of immigrants fighting for Husky. You think they don't want to have children? What do? When we're talking about hospitals, they can't even really give the hospital their name. What do? Right? Representative Pierce, you made a point in saying times are different now. Are they really? That the way we raise our children is different now. I slightly disagree with that. Because how I was raised was culturally. So I raised my sisters and brothers who became my children the way my mother raised my children, and so forth and so forth. The difference is we still had systemic problems and no access. We didn't change the way we raised our children, that's culturally. Society has decided that these things, right? We got all of the TikTok, the this, the that. But a home, I don't think we're raising our children differently. I think the times are different, and we have to adjust to those times, right? It's not that we're raising them different. So this is one that is very personal to me. I had friends who left their children, as I told you last session, and Rep. Pierce, me and you and Rep. McGee was in the hallway. And I said, McGee, who's from my project, who is Stowe Village, we're all from the project. When people abandoned their children, where would they leave them when we was coming up? And what did he tell you? He said, at the dumpster. So this isn't a figment of our imagination, right? These are communities we came out of, and these are the things we've seen in our community, and those things are still happening. They're just not reported. We're not documenting them according to how many black children, how many, so you don't know. We just say 55 kids, which no kids, right? We could save any kids. But I would argue that a lot of us just didn't know. So to Rep. McGee's point about marketing, about making sure that, I don't know, it's some grassroots campaign where you working with the municipalities. I seen the CCM here. Maybe it's partnering with them to make sure their human resources and other departments of public health get this information out. Because I didn't know that this existed until last session. I had no clue that there was a way other than adoption that you can surrender your child. And so I don't mean to be emotional. I hadn't talked about this in a while when it's attached to, losing my parents, becoming a parent to my siblings, and then never having children. And I'm so glad that you guys are taking up this task force, and I support it. And I know you have your work cut out for you, but you're intelligent people, and I think you can trying to figure out how to give women other options is not a bad thing. Thank you.
Thank you so much for your testimony.
Thank you, Madam
Not
Chair.
easy, and you did it, so
Thank
we
you.
appreciate you. Representative Paris?
Thank you, Madam Chair. Janice, you and I have interacted in this building a lot, so I hope it's okay that I refer to you as Janice.
Of course.
What you just shared was very vulnerable, and it was very raw, and it was necessary, obviously, to the topic at hand. What I would like to share is something equally as important.
Mm-hmm.
As someone who had been told at a younger age by a parent I would have been better off aborted,
Mm-hmm.
as someone who grew up with all the trappings and trimmings of a safe suburban life, but also faced abuse at the hands of both my mother and stepfather, physically, emotionally, mentally, until I was the age of 18, when I left home at 18 years old and went on my own with no money and no clothes, nothing that belonged to me. For someone whose grandmother was a social worker, and when I spent weekends with her, because it is a cultural thing to spend weekends with your with your extended family, and my grandmother would see bruises on my back and on my buttocks, and as a social worker couldn't do anything to help support me. I understand that access is critical. I understand that all access does not have availability in every zip code.
Right.
I also understand that what is a very true statement, and the disparities are even greater based on what you look like, but for women in general.
Right.
If this were an issue faced by men, we would declare it a national, international health crisis to ensure that men got all of the care that they needed. But when it comes to women and children in our society, we do not do the same, which is why this committee, regardless of party, is so important. So I do understand, in a different lived experience lens, that healing work obviously happens through the policy work of this committee and of this building. And I understand that it is personal. What I also understand too, and I want you to hear me when I say this, is that as we defend every child, in whatever form and however they are, it is our job as a state to ensure that the traumas that you have faced in your zip code and the trauma that I have faced in a zip code that no one ever thought would be an issue, because I went to a predominantly white school, because my family had means, there's no way I could be abused. We need to stand for those people, for those who are marginalized. And because of that, for the mothers who are pregnant, who have no outlet, who are even married and having their first child, and they're not educated on the dangers of postpartum challenges and issues. We also need to examine that. So I understand when you say to me, culturally, how we raise our kids has not changed. The times have changed. Yes, ma'am. And I want to challenge you on that thought as well, if you allow me.
Of course.
It has changed. Times have changed. But also, we see the great falling away of families in this country regardless of race. There's a higher number of parents who don't have access, who don't have relationships with their children in this day and age, mostly because of the traumas that we are facing.
Right.
So I do understand what you were saying, and I hope that this task force will not only be able to help us find some of the answers to the challenges that we are facing, but I hope that this task force, when it gets on the floor in both chambers, will help to solve the wrongs and help to right the wrongs for those who are still triggered by the traumas of their past that are both cultural and generational. Because now is the time for us to try to put that out of the way. And that is exactly why I could have been the chair of many other committees, but it was more critical to be the chair of this committee because I wanted to heal the young person, similar to myself, that did not have systems, as we talk about systemic issues, that did not have systems in place to protect them because of access that kept our systems out of our homes. So I feel for you and I appreciate, I say this with passion as well, not in an angry or aggressive way to you.
I get it.
But I appreciate you sharing that because our stories drive the work that we are doing. Thank you, ma'am.
Thank you. I want to thank Ms. Bennett, who was here before me. When she shared hers, I was not going to tell y'all that. You know, I was like, but after hearing her be honest about her truth, it was important for me to be honest about mine. But let me leave this with you, Corey. We have begun to address our trauma. That's why we're here. We have begun to break the generational curses that have plagued our Black communities with abuse and trauma and lack of access. That's why you and I are here. That's why I lobby. That's why you are here. And we're changing those things. And what we need to do is make sure that our colleagues and everyone else know that these changes have to happen. And I appreciate you, brother, for chairing this committee and seeing that to be true, to make sure that children are represented and have access, and that we change some of the systemic problems that we have in the state of Connecticut around children.
I appreciate that, and please do not take my leaving in any disrespect.
I don't.
I'm just late for another meeting, and I just need a moment to myself. Thank you, ma'am.
Okay.
Thank you, madam.
Thank you.
Representative McGee.
Thank you, Madam Chair. The first thing that I want to do is validate your testimony and experience. Thank you for what you shared, because it's challenging being a woman, but the addition to that is how hard it is being a Black woman. Malcolm X said that Black women were the most disrespected, unprotected, and neglected in American society. And the weight and the density in which we carry for our communities, people just don't understand. There are currently 5 Black women serving in this legislature, and the weight of what we carry is insurmountable. Because while a group may have collective power, right, 5, which represents grace, right? The weight of what we carry is greater. This population of people, you guys have 20 issues to tackle. 20 of you, each of you can tackle one. If black women get together, you guys got 4. You got to tackle all those different issues. So the weight of it, the density of it is on another level. Thank you. I'm going to validate you again for sharing and being vulnerable, because we're not given spaces to do that without seeming harsh or aggressive. When I first ran, I knew that my experience of advocacy came from the Black mighty women that came before me. And my grandmother, I don't know how she got this done, but she would get a mobile mammogram screening truck and bring it into the inner city, into areas and neighborhoods where women were often neglected. But that same grandmother, who ran for office in the 70s, experienced a lot of systemic barriers. I often say I'm the blossoming of her seeds. But she says something to me that grips me to this day. She says, when black women were young and getting abortions, no one ever told them what was actually happening. So she said, the moment in historical time where scientists talked about what takes place, she said there was a massive mourning in the black community, because there was no education or resource around what women were deciding. I oftentimes find it silly when I hear people say, I have less rights than my grandmother. Because as brilliant as my grandmother was, she was never able to go to school. The first time she ever went to the dentist, she was a grown adult. 73% of women would prefer to parent if they had the resource.
Right.
I hear from these women. I read their emails. I get their phone calls. I get their letters. And to be honest with you, if people were met with the stories I am, they wouldn't be able to sleep. So I thank you for sharing what you shared. And as many people think, they think I'm an anomaly. They think we're anomalies, but we're not. We're just vocal. So this legislation, to me, is a door opener, as many have been before, to a greater conversation. And that is removing self-centeredness from the core of politics and identifying with the true needs of individuals, even if you don't like it because you feel like it doesn't politically serve your party. And again, I thank you for sharing. I'm glad that you, Brandon McGee, and Rep. Paris had that shared that moment. I remember him saying, yeah, I remember growing up and there was always stories of babies found everywhere. And the reason why I wanted to know the statistics ethnically is because I know the impact of this on the black community. It always leads back to a lack of knowledge, not a desire. I chose this from a place of not understanding and knowing more than it was something that I really wanted to do.
Or fear.
Or fear. And then lastly, I'm closing out, validating your experience again. Thank you. I was driving through a neighborhood where one of my favorite billboards was a little black baby with an afro. And she had a book, and it was encouraging black children to read. And I drove through that same neighborhood, and that billboard was removed. And it was all about abortion. And that same neighborhood, right, where girls know where to go.
Yeah, already.
It went from learn to read to abortion. And that billboard was up for a long time. I love that little chocolate afro baby with the open book. And so what we need to realize is the inception of the ways in which these movements were established, they have not changed. They've just become more eclectic. And the ways in which it has overshadowed or eradicated the very voices in which it has impacted the most, it's caused us to normalize trauma and accept elitism. So, thank you.
May I? Because I hear you when you say that you're one of 5 black women here. I'm the only black woman-owned lobbying firm in this whole state of Connecticut. And I can't tell you how many times I've reached out to white women in both the Republican Party and the Democratic Party, and no one has responded or picked up the phone. it even made me fearful of here because I don't know many of them that I see, and I don't know how they're going to react to me given where I stand on this, because sometimes we get so caught up on Democrat and Republican that we're not focusing on right and wrong. But then I realized that I've been here 5 years and they still haven't met with me, so at this point I should at least say what I feel. And so I get that whole lonely feeling, that feeling you feel by yourself, because as a Black woman who owns her own firm, who can't get white women in this building to meet with me about anything, not all of them, because Jillian Gilchrist has been good to me, I sympathize with you. I sympathize with Khan and the other few Black women. I mean, guys, sorry, you know, I'm trying to, because I know you, I keep forgetting to approach you the proper way, but Rep. Belton, it makes it difficult to stand up, and I appreciate you for standing up and understanding that you may not be liked after that. And so today I said I was gonna just be courageous. And then Ms. Bennett told her story, and so I decided to tell mine. So I just thank you all. I'm sorry, I'm usually not this emotional, but you know, it was a time. I'm glad that my siblings are grown. I'm glad that they're all productive. I think my mom and dad would be very proud of what we've all done. And if you all could just figure out how to make sure we save more children, I would be so glad. Thank you so very much.
Thank you.
Have a nice evening, ladies.
That ends our public hearing for the Children's Committee on, today's the 17th of February. Thank you.